नमामि धन्वन्तरिमादिदेवम् सुरासुरैर्वन्दितपादपद्मम् लोके जरामृत्युनाशम् दातारमीशम् विविधौषधीनां शङ्खं चक्रं जलौकां दधतं मृतघटं चारुतोर्भिश्चतुर्भिः सूक्ष्मस्वच्छादिरुद्यं शुकपरिविलसन् मौलिमं भोजनेत्रम् कालाम्बोदोज्ज्वलाङ्गं कटितटविलसत् चारुपीताम्बराढ्यं वन्दे धन्वन्तरिन्तं निखिलगदमिव प्रौढदावाग्निनीलम्।
Namaste to all of you. Myself, Dr. Naveen Joshi. I'm just, and again, we are just here. As you know that in last Sunday session, Professor Dr. Raghavendra Udupa was with us, and on the series of lecture, today also he is present. The title of the lecture is Differential Diagnosis of Nija and Agantuja Roga, with an example on each case based on the reference of Charak Samhita. But before handovering the mic to Professor Udupa, मैं बताना चाहूँगा कि यहाँ बहुत से लोग हिंदी भाषी हैं और आयुर्वेद में हम चरक संहिता पर बहुत सारे लेक्चर चला रहे हैं. Dr. Raghavendra Udupa is professor and head of the Department of Samhita and Siddhanta in Yanupa Ayurveda College, Mangalore, Karnataka. He has teaching experience of 19 years, UG and 10 years PG. He has clinical experience of 19 years in Sri Raksha Ayurveda Clinic, Udupi. His special focus in the clinical practice, that is Ayurvedic diagnosis on the basis of textual references from Charaka Samhita and Sushruta Samhita, assessment of Graha Roga and Bala Graha Roga based on findings of the Aura scanner on geopathic stress scanner, and preparation of the medicines mentioned in Charaka Samhita and Sushruta Samhita. It is in his manufacturing unit, that is the Gorgia Pharmacy, practice of Daiva Pastre Chikitsa, a very unique branch of Ayurveda. He is one among the editorial board of the Charak Samhita published by the Munyal Ayurveda, regularly conducting series of classes on understanding Charak Samhita, that is Charaka Chintana, since 7 years, practicing Marma Chikitsa and Asti Bhagna Chikitsa, directed 3 documentary film, very nice, Doctor, of Ayurveda, and in 2016, the Prakriti Ayurveda Pratishthan honored him with a title, Rare and Special Personality of Ayurveda. Welcome, sir, on the Ayush Darpan Journal's Facebook page, and soon this lecture will be, definitely this will be premiered on the YouTube also. हमारे साथ बहुत सारे लोग यहाँ जुड़ गए हैं. वैशाली जी, माधुरी गुले जी, अंजना जी, तबरेज अली जी, विस्मिता जी, पूजा जी, जसवंत सिंह धनई जी भी जुड़ गए हमारे साथ. बहुत बढ़िया, स्वागत है आपका. राजेंद्र कौर जी, ऋतिक राज सिंह राजपूत जी, अक्षय शर्मा जी, विष्णु कृष्णन जी, चैत्रा जी, किमया दाइफले जी, बलजोत वारा जी, श्रुति शर्मा जी. हम आपसे अनुरोध करेंगे कि पहले आप डॉक्टर साहब का लेक्चर देखिए, फिर आप उनसे इंटरेक्ट करिए. तो सर, आपका बहुत बहुत स्वागत है. वेलकम. And I'm just allowing you to share the screen, and I'm just making you the co-host.
Okay.
Yeah.
Okay. Good evening, everybody. I hope if I speak, if I explain in English, most of the people will understand because I use very simple things and
Sir, unmute yourself, sir. Unmute, sir. Sir, muted. Unmute, sir.
okay.
Unmute,
Okay.
sir. Yeah, yeah. Again muted, sir. Again muted, sir. Unmute, sir.
Yeah. Now it's okay.
Yeah, it's okay.
Okay. Yeah. I have to do share screening. Okay. So we'll
Yeah.
start the second lecture on the Charaka Samhita and its diagnosis and the treatment. So what happens when in the clinical practice, we study Charaka Samhita in first year, I mean second year and third year as Charaka Purvarda and Uttararda, and we get some marks, and then we forget about Samhitas. We feel that it has something, but what it explains, we cannot understand what is the thing which is useful for us. So again, this is also again thing which I am going to explain. It is based on Charaka Samhita. So I hope you can see the things. Yeah. Uh, I hope you will see this screen. Yeah. Okay. So today we will discuss about the differential diagnosis and treatment of Nija and Agantu Vyadhi. Here, we know that Nija Vyadhi is due to involvement of dosha and Agantu is something which is not with the involvement of dosha. But in real sense, how we can identify Nija and Agantu Vyadhi? Here I am explaining with an example, a case study where I have interacted or I have dealt this particular patient twice in 2 years. That is, one is 2019 and another is 2020 with a gap of 1 year. I'll explain that. That is different. And how you understand a person, that is aturasya antaratmanam gatva. That is my intention to explain. Here, a single case, it is explained twice. That is case study. It is though it is Nija and Agantu, a same case will be explained twice. Then you can understand how and why it is so important to understand Agantu factor. Of course, I utilized Charaka Samhita references and Sushruta Samhita references. I thought I will use it. And finally, when I saw the number of slides, I thought I will talk about Sushruta Samhita in another day because understanding Charaka Samhita and Sushruta Samhita are in the different perspective that we are not going to discuss here. So today, again, we are discussing about the topics of Charaka Samhita with a base of a case. And we will directly come to the case. Name, he is a male, we'll call him as SB, aged about 35 years. And he is residing near Udupi, around 20 kilometers from heart of the Udupi. He is a priest by his profession. And 2019, around January, February, he came with two complaints, that is pain abdomen and lack of appetite or reduced agni and chest pain. And he said that these were there since last 2 years and he has taken medicine for chest pain, reduced appetite and pain abdomen, and he didn't get much relief by the treatment, both modern treatment and Ayurvedic treatment. And he has explained these as main complaints. And as I have explained in the previous lecture series, usually I refer the text or I depend upon the textual reference for understanding this particular patient, as we have studied, that is Laukika Pratyaksha and Alaukika Pratyaksha are there. So patient sitting in front of you, he is a Laukika Pratyaksha. He has experienced the disease. That's why he is Laukika Apta. And Alaukika Apta means the textual references like Charaka Samhita, Sushruta Samhita and all. And those are written long back. and they have explained something which is known as the Aptavachana, and you have to compare these two. And initially I opened a chapter and I asked, do you have giddiness? He said yes. Do you have pain in the back and pain in the sides of the back or pelvic area? He said yes. Then do you have sore belching and burning sensation in the throat region and burning sensation in the abdomen? He said yes. That is Amla Pitta disorder or Amla Pitta. Then do you feel that whatever you have ingested or whatever food you have taken or you are taking is not going to digest properly? He said yes, that is avipakam. Then the first step of your diagnosis, it is pitta jagadam or pittaja disorder. And when I asked some other disorders or some other symptoms like pain in the different body parts, then he said yes. Then it is Vatajan Gadan or Vataja Rogas are also present. Then Shakrat Gatam Kukshi Rogan. He was feeling that he is having something, a major problem in his abdomen, that is Kukshi Roga, and it produces or it produced due to the doshas are present in the Shakrat or the Mala or Purisham. Then that is also present. Then these are nothing but Ajiranasya Samanya Lingam. Like when you see the Samanya Lakshana of Ajirana in the Charaka Samhita Chikitsa Sthana, that is 15th chapter, that is Grahani Dosha Chikitsitam, you will get these symptoms. Whatever said in the text that is appreciated by the patient, that is experienced by the patient, and you come to a conclusion, or I came to a conclusion that this is a Lakshana of Ajirana, or this is Samanya Lakshana of Ajirana. And again, this is not sufficient for the treatment purpose. Again, I have interrogated with the patient. When again I saw the textual reference, that means I opened the text and I asked these questions, and he said yes for these symptoms which are explained in the text. One is Durbalaha Agnihi, the Agni or capacity to digest food, that was very minimum during 2019. And Vidahati Annam. Vidahati Annam means whenever there is digestion of food, he was feeling daha or some discomfort during the digestion of the food. That is called Anna Vidaha or Vidahati Annam. That was present. Then Atisrastam Vibadham va Upavishyate. In the text, it is mentioned Upadishyate. It is not Upadishyate, it is Upavishyate. So it is the passing of fecal material. Sometime it is very hard or constipated. Sometime it is very loose or fluid in nature or liquid in nature. That was there. Then Sa Asti Parvaruk, pain in the bigger bones and pain in the smaller joints. That is Asti Parvaruk. That was present. And along with that, Tikta Amla Udgaram. Sometime he was having Amla Udgara and sometime it is Tikta Udgara. All these features were present. Then that is nothing but Mandagni Vyapara. It is told in the text. You just open the 51st to 54th shloka of Charaka Samhita, Chikitsa Sthana, that is Grahani Dosha Chikitsita. You will get these symptoms. It is not like something imaginary what I have explained here. These are present in the text. And when I read in front of the patient, many of them were not there, but these symptoms were present. He said yes to these symptoms. So on an outset, you have a idea that there is Mandagni in this particular patient, and there is aggravation of Pitta dosha, and there is aggravation of Vata dosha. So that is a brief idea about this particular patient. And when you see the text, when you read the text, then you will get the idea that in the same chapter, in the shloka number 57, it says, Durbalagi Baladushta tu Amam Eva Vimunchati. When there is Durbalagni and dushta dosha or vitiated or aggravated doshas, then the ama will be passed in the fecal matter. Then what is ama? That's a big question. We have so much of theoretical explanation for ama, but in the real sense, when you see the textual reference or the dictionary reference of ama and pakwa, ama means it is uncooked or unripened. That is the meaning of ama. And pakwa means it is ripened or properly cooked. So that is the meaning which is explained in the some of the dictionaries in Sanskrit. So here ama means vimunchati means it is for purisha visarjana. Amam eva visarjana means it is the undigested food will be seen in the fecal matter. So that is ama. We are not discussing about what is ama and what are the definitions of ama, how it is produced. I'm not discussing here because the nidana of this disorder that I have also elicited, that will be explained later. So what patient has experienced is amam eva vimunchati. That is, the undigested food is excreted and that is present in this particular patient. And in the context of this particular chapter, that is Grahani Dosha Chikisitam, when we read this particular chapter, we feel that Grahani Dosha Chikisitam means it is a treatment for structural involvement. But in reality, it is a treatment for functional derangement. Here, instead of telling Agni, Grahani is mentioned because Agni Adhisthana is Grahani, or Grahani is Ashraya and Agni is Ashrayi. So based on Ashraya Ashrayi Bhava, instead of telling Agni Vikara Chikitsitam, the author mentioned Grahani Dosha Chikitsam because Grahani is the place for Agni. So it is based on Ashraya Ashrayi Bhava. Instead of telling that, I'm going to explain the treatment of Agni Vikara or Kaya Agni Vikara or any Agni Vikara. He mentioned the term Grahani Dosha. It is not like Agni Dosha or Agni Vikara. So it is based on Ashraya Ashrayi Bhava. And if you see the Chakramani commentary on shloka number 1 and 2 of the same chapter, that is Grahani Dosha Chikisitam, he says, Grahanim Ashrito Agni Dosho Grahani Dosha. What is Grahani Dosha? Grahani Dosha is nothing but it is the treatment of deranged Agni which is present in Grahani. And as told by Chakrapani, we have to take Grahani Dosha as Agni Dosha, or Dosha is the word for disorder also. If you read Charaka Vimana Sthana 6th chapter, so Grahani Dosha means it is Grahani Vikara, and you have to interpret it as Agni Vikara or disorders related to Agni or Kaya Agni. So here, this particular patient, he is a typical patient for treatment of Agni. So that was assessed when these symptoms were elicited in the patient's textual references. And after eliciting the textual references for Mandagni and involvement of Vata dosha and Pitta dosha, the individual nature of the Grahani dosha, which is explained in the text, that is seen right in front of the patient. And I could see Vataja Grahani Lakshana and Pittaja Grahani Lakshana in that particular patient. If you see the Vataja Grahani Lakshana in Charaka Samhita Chikitsa Sthana 15th chapter, you can see there is Ratpida, pain in the cardiac region or chest region. Then Daurbalya, weakness. Then Griddhihi Sarvarasanam, that is not taking or not feeling interest to take any of the Shadrasas. Either it may be Madhura Rasa or Amla Rasa or Lavana Rasa till Tikta Rasa. He is not taking or he is not interested to take food of any taste. That is Griddhihi. Griddhihi means Virasata, or he is not showing interest. Griddhihi Sarvarasanam. Then Manasaha Sadanam, feeling of dullness or lack of interest, that was appreciated by the patient. Then This is very important. Every time the person or patient is feeling that I am going to suffer, or I have a problem of heart, or I have problem of something on the left side of my abdomen, and something is there in my abdomen. That is sa vata gulma radroga pliha shanki cha manavaha. That's why he has underwent ECG for many times, and he has taken the scanning, abdominal scanning, twice, and there was nothing which is conclusive to his problem. And he said, I feel that I have some heart problem, or I have problem in my abdomen. That is the Vata Gulma Radroga Pliha Shankicha Manamaha. You may ask, what is Gulma? Gulma, it is a disorder where a pain is a prominent symptom, and sometimes a mass can be appreciated when there is severe pain. I have seen only 2 patients where a lump or mass is appreciated because of severe pain. So that is the gulma ityavidiyate. That is the definition. Or you can see a palpable mass, parshopalabhyaha. That is the definition of gulma. We are not discussing about gulma, but that is present in some of the patient. Otherwise, the pain is the maximum symptom, or the pain is appreciated in the abdomen. That is the symptom of gulma. And in Sushruta Samhita, if you read Sushruta Samhita, the Gulma and Shula are explained together. After Gulma, the Shula Roga is explained in the same chapter. That means the disease Gulma, it is always associated with the Shula or pain abdomen. So in clinical practice, any pain abdomen condition can be correlated to Gulma. If some palpable mass is seen, then that shows the severity of the disorder. So here, the palpable mass was not appreciated, but there was pain abdomen and pain in the chest region, and pain in the left side of the abdomen also. That is a symptom simulating sa vata gulma radroga pliha shankicha manavaha. So this is the symptom. When it is continued, the symptoms of pitta jagrahani, that is also present. That is amlodgara. It is already told. Ratkantadaha, it is already told by the patient. Then ajirana saryate. Ajirana means the undigested food will be defecated in the fecal matter. Then pitabaha saryate. Always the fecal matter is yellowish in nature, and sometimes it is liquid in nature. That is pitabaha saryate. So you just open Charaka Samhita, Chikisasthana, 15th chapter, about Vata Jagrahani Lakshana and Pitta Jagrahani Lakshana. You will get these symptoms. And patient told, yes, I have these problems. Whatever you have asked, that I have experienced. That means there is a matching between the symptoms explained in the text and the experience of the patient. There is a similarity. Then the diagnosis is Vataja Pittaja or Vata Pittaja Grahani Dosha Lakshana. That means there is involvement of Agni, there is Mandagni, and because of aggravation of Vata and Pitta in Grahani, there is a condition called Vata Pittaja Grahani Dosha. And I have asked about the food habits of his particular condition. He said, since last 2 years, he was working in a temple, and he was appointed for a special purpose temple. And during those times, he was not taking the normal food or food from the home. And there was some maladjustment to the food also. The timing, everything was disturbed. He said, probably because of that, I'm suffering from this. That was told by him. And as I said, there is involvement of Agni, there is involvement of Vata dosha and Pitta dosha in this particular patient. So the Hetu or Samuttana Vishesha is, you can expect that there is change in the food pattern, and there is change in the working condition also. And Vikara Prakriti, I said, it is Mandagni is present, and Pitta and Vata doshas are increased in the abdomen. and the symptoms of Vataja Grahani and Pittaja Grahani are also seen. That is, there is involvement of Agni or Kayagni and Vata dosha and Pitta dosha. So this is like a general outlet of this particular patient. And then you may ask why Agni and dosha are so important, or what is the relation between Kayagni and dosha. If you see Charaka Samhita Chikitsa Sthana, 5th chapter, that is Gulma Chikitsitam, you can see a reference which says Agni is base for aggravation of Tridosha, that is Vata Pitta Kapha. That is Shama Prakopo Doshanam Sarvesham Agni Samshritu Tasmat Agnim Sada Rakshet Nidanadicha Varjayet. Here, the Agni, that is Ashraya for Tridosha, for normalcy and abnormalcy. That's why you have to keep Agni in a proper state and you have to avoid positive factors. Then I asked, can you change the food pattern? He said, no, I have appointed for a particular purpose and I have to be there for another 6 months and in that particular temple, so that I cannot change my food pattern. And in another reference of Charaka Samhita Sutra Sthana, which says, or which explains about the importance of Antaragni or Kayagni. And here it explains with an example of doing or performing an yajna. That is, Hita bihi juhuyat nityam. Juhuyat means it is giving offering to the fire in the form of yajna. In yajna or yaga, what you do, you take or you select a particular form of plant origin sticks like ashwatha or something like udumbara, etc., which is known as samit. So samit, it is taken and it is offered to the fire along with the ghee, so that the fire will be very strong. Similarly, for a human being, every time you have to offer hita ahara to the body, that is annapana samidbihi. That is, annapana should be hita to the body. And what is hita and what is priya, that is explained in the same chapter, that is Charaka Samhita Sutra Sthana 28 chapter, that is the last chapter of Annapana Chatushka. So priya ahara means the ahara which will give taste to you and which is not causing problem at immediately, but later on it may cause some problem. That is called priya ahara. Hita ahara means during consumption of food, you may not feel that this is very good, or you may not appreciate the taste of the food, but in long term, there will be proper health and you can appreciate the impact of hita ahara. So that is the difference between priya ahara and hita ahara. In modern times, this is very important that we are supposed to taking priya ahara than hita ahara. Even the patients are expecting even the medicines of good taste. They say give some medicine which is very sweet in taste, give some medicine which is very tasty, or give some medicine which is liked by my children. So that is the wordings of the patient. That means they are more oriented to priya than hita. So here the author says you take hita ahara or hita annapana in the form of samit or the sticks which are used for performing yaga or yajna. Similarly, offer annapana which are hita in nature, and then the antaragni will be protected or antaragni will be maintained. Then the last part of second shloka, it says matra kalau vicharayan. And what is matra kalau vicharayan means you have to consider matra and kala which are explained in the text. Here, if you go to Atita Anagata Vikshana Tantra Yukti or Atita Vikshana Tantra Yukti, the matra and kala, Charaka has kept 2 chapters for explaining these 2 factors. The matra, understanding matra and explaining matra, he has explained matra shitiya adhyaya, that is Charaka Samhita Sutra Sthana 5th chapter. And the first shloka or third shloka says, Matra she syat, ahara matra punaha agni balapekshini. And Kalu Vicharayan, he has kept another chapter that is next to the Matra Shitiya Adhyaya, that is Tasya Shitiya Adhyaya, where 6 seasons or 6 Ritus are explained, and each Ritu, how Agni will be, and what should be your management in terms of food and diet. So that is explained. So Matra Kalo Vicharayan means you have to study 2 chapters of Charaka Samhita. One is Matra Shitiya Adhyaya for Ahara Matra. Another is Tasya Shitiya Adhyaya to understand Agni and Kala. And Matra Shitiya Adhyaya and Tasya Shitiya Adhyaya are the 2 chapters which are considered as first and second chapter of Swastha Chatushka. If you want to be healthy, then first Ahara Matra should be considered, and then second chapter it is Agni along with the seasonal variations. According to seasonal variation, you have to modify the food. But in the modern society, we are not considering those things in our daily life. Our food habit it's almost similar in 365 days, and we are not taking Kala Vichara there. We think that we are taking an ideal food, but according to Ayurveda, it is not a proper method of consuming the food. And because of these things, we will have some problems in Antaragni or Kayagni. And if you correct these things, then sometime the disease will be cured by the proper correction or Nidana Parivarjana. And as I asked for him to correct the Nidana, he is not in a position to correct it properly because he is working for somebody else in a temple, and he was appointed for a particular purpose for a period of another 6 months. That's why that was not possible for me to correct Matra Kala Vichara in a proper way. And then I thought, okay, I'll give some medicine. Then he said, okay, I'll take medicine, whatever you give. And he said, I have taken medicine, Ayurvedic medicine, even before also, but I didn't get any relief out of it. Then I told, no, I have referred the text and I understood you in a proper way, and accordingly I'll give medicine. He said, okay, it's your decision, and I'm not a person to disturb your decision. Then with these references, like Grahani Mashritam Dosham or Grahani Ashritam Dosham, Vidagdahara Murchitam, that is Dehar Vidaha, then Amalingan Mitam Drishtva, if there is Ama condition, as to I told in the beginning, there is Ama, Amalingan Mitam Drishtva, Palanam Kashayena Uddare, that is Vame. So you have to do Vamana Karma with Madanapala Kashayam. Here, no snehana or no abhyantara snehana and bahya snehana and svedana are performed because it is against to the textual references. Only Madanapala Kashaya is administered just to remove the ama condition which is present in the abdomen. And snehana and svedana, it is not performed. And then Vamana, that's the usual pattern in the clinical practice. You do Snehana, you do Svedana, then Vamana. Text, according to the text, according to Charaka Samhita, in the context of Grahani Chikitsa, that is not advised. Only Uddharet, that is Vamed, is explained with the Madanapala Kashaya. That's why only Vamana is administered. And if you see the previous references of Asnehya, the person contraindication or person contraindicated to Abhyantara Snehapana, in which Ama and Garavisha are considered as Asnehyam. They are not fit for Abhyantara Snehapana. That is Ama Gararditaha Asnehyaha. Again, with this particular rule, Snehana or Abhyantara Sneha is not followed. And Madanapala Kashaya, it is administered with a dose of 4 glass, that is 800 ml, that's 4 cup of Madanapala Kashaya. Usually I collect Madanapala for my purpose, and with amount or with the quantity of 400 to 800 ml of Madana Palakashaya, usually the patient will feel nauseating sensation and vomiting. And I have administered 4 glasses of Madana Palakashaya to this particular patient. And there was Shamyak Vamana, that is Kafanta Vamana. And the patient felt lightness of the Ashayas. And he felt something like something is going to improve. That is Samyak Vamana Lakshanam. And after that, Laghuvanna or Laghu Ahara in the form of Kanyi, that is rice gruel, that was given for 5 days, because more than 5 days, 7 days, it was not possible for him to stay away from his temple. That's why he told maximum for 5 days I can stay away from the temple, so that for 5 days Laghu Ahara is administered. And after that, after Prakritigata Purusha Lakshana, it is assessed, that is Sarvakshamo Samsargo Ratiyukta Hastirendriya, which is explained in Charaka Samhita Siddhisthana. Then Deepaniya Yogan or Deepanan Yogan, or what we call Deepaniyani Dashemani. The drugs are selected from that particular context of Charaka Samhita Sutrasthana, and Trikatu is selected. I have Trikatu tablet of 250 mg, and I have administered Trikatu tablet thrice daily, 1 tablet before food, and it is given for 7 days. And all the references of Charaka Samhita are taken for proper treatment or proper management of this particular patient. So initially Vamana is administered, then it is Laghuvanna is administered in the form of Samsarjana Krama, then Deepanan Yogan or Deepaniyani Dashemani, it is administered for 7 days. And he came after 15 days with these medicines and treatment. There was no improvement. Again, he was saying that there was Ama Mala Pravritti or Adaha Ama Pravritti that is continuing. And considering that still Ama is present inside the body, again, another reference of Charaka Samhita, Chikitsasthana, 15th chapter, it is taken, which says, Nagaraha Ativisha Mustakvataha Amapachanaha Syad. If you administer the Kvashaya of Shunti, Ativisha and Musta, there will be Amapachana. And it is administered for 7 days. The Amapachana Kashaya, it is administered, that is 100 ml twice daily before food, that is morning and night before food. It is administered, and it is administered for 7 days, and there was no follow-up. He didn't come after that. So I had a chance to treat this particular patient for a period of around 1 month, that is the Vamana Karma, and then for 5 days for Laghuvanna, and 7 days for Trikatu administration, and 7 days for Kashaya of Nagara Ativisha Mustakvata. So that within a gap of 1 month, I didn't get any report from the patient. I didn't get any call from the patient, and I was not knowing whether he is having same symptoms or he got relief or not. Sometimes when you are not getting a patient for further follow-up, means there are multiple probability or many probabilities. Well, the first probability is he is completely cured from the illness, so that he is not coming to your clinic. Another is he is not at all getting any improvement. That is the second treatment or second possibility. The third possibility, which is considered as worst possibility, is he is no more because of your treatment. That is Vaidya Apachara Krata Vyadi. Sometimes that is also a possibility. The fourth one is he is consulting another doctor for the same problem. So these are the probabilities of a person who is not reporting in the course of the treatment. So in the clinical practice, we have or we will get these type of patients. Initially, they come and they explain everything, and you are also showing the maximum effort, and you put maximum effort to cure that particular patient, and they are not understanding what you are going to say and what you are going to perform. and they are not showing much confidence in your treatment, and they are not coming for further follow-up. And in this patient also, same thing had happened, that I didn't get follow-up after 1 month. And then after a gap of 1 year, again, this patient came in 2020, around February. He came with similar complaints. He said, Doctor, I visited your clinic last year around same time. And after that, I consulted modern doctors, specialists. Then they advised me to do blood report, liver function test, then endoscopy and ECG also. And the reports he showed me, ECG, it is normal, that is no abnormality detected. Blood reports are within normal limits. Liver function test, they are also showing no abnormality. And gastroduodenoscopy, it shows mild gastritis. And he took treatment of modern medicine for 6 months. He didn't get any relief of from this problem. And according to the doctors, the special experts, they said, we are not getting much conclusion that you have a severe problem. Probably because of your tension or workload, you are getting this. That may be the cause for your problem. Then he stopped the medicine. He discontinued the medicine, modern medicine, and again he took Ayurvedic treatment for 6 more months in a clinic where he is residing nearby to that particular doctor's house. And the doctor who was treating this particular patient is my student. He is having orientation to understand and apply the concepts of Charaka. And same thing he did, whatever I'm doing in my clinic. And that student who is practicing near to that patient's house, he said, you are suffering from Vata Pitta Grahani, and I am giving medicine for that. And he administered medicine for Vata Pitta Grahani for 6 more months, and there was no improvement. Then he told everything after 2019 or after the Vamana and Laghuvanna Pratibhojana, etc. Then he took these medicines, and then also there was no improvement. And during 2020, he was suffering from debility, severe debility, and giddiness quite often when compared to previous visit. And he was totally upset. What is going on? Whether I have some normal or abnormal problem in the body, or is there anything else which I have to check? So these were the symptoms or complaints asked or the explained by the particular patient during the second visit. So till now, till 2019, until the Vamana and Deepaniya Aushadha Prayoga, you consider this as a patient number 1. And in the second visit, that is 2020, same patient, he came with similar complaints with some more severe problems. And he has taken treatment in between, both modern and Ayurveda. He showed the reports to me, and he is totally upset. And you consider him as the second patient because there are some changes in the symptoms also, but the original symptoms were present. Whatever I have diagnosed in the beginning, in the 2019, those symptoms were there. Along with that, there are quite a few symptoms which are advanced or which are increased or which are added to those previous symptoms. Then in the clinical practice, you feel that what is the diagnosis? Am I wrong? Or am I wrong or other doctors are wrong? Or what is going inside this particular patient body, and how this particular patient can get a better relief? What is Vikara Prakriti? As I have explained, I have seen this particular patient as per the textual references. Many references of Grahani Chikitsa and other chapters are taken to understand this particular condition, and medicine also selected from the text. Then also he is not responding. Then what is Tridosha Siddhanta? Though I have applied Tridosha Siddhanta and Yukti Vapashriya Chikitsa, then I am not getting any result, or patient is not satisfied by my effort. Then you start thinking that whether it is Nija Vikara or Aganta Vikara. So usually in such condition, you will start thinking that probably this patient is having something else beyond Tridosha Siddhanta, because on an average, almost all the patients, they show the Tridosha Siddhanta references, or they follow the Tridosha Siddhanta references. Like this patient, he is following the Agnidushti references. He is exhibiting the references of Vata Jagrahani. He is exhibiting the references of Pitta Jagrahani, but still there is no improvement. Then you should think that there is Agantu Vikara. Usually in the clinical practice, what I have noticed in other practitioners, when they come to this particular junction or this type of junction, they start deviating from Ayurveda. Either they go for yoga, or they go for homeopathic medicines, or they go for some counseling or some other techniques which are available, which are presently they are considered as good for cure of diseases. Or they stop thinking about Tridosha Siddhanta, because every time when patient come and say, doctor, I'm not getting much improvement. I'm taking medicines from you since 1 year. I'm not getting any improvement, whether this disease will be cured or not. Or sometimes they directly ask, are you capable of treating my condition? Because the confidence level is always sinking when you get such type of symptoms. But here in this particular patient, he didn't ask much questions about his cure, but he discontinued the medicine, and next year he came with similar complaints. And whatever I have experienced in the most of the Ayurvedic clinics, that they think in another way and they start with experimenting with the medicines. They say, I have some more medicines, we will try with the medicines. That means without understanding the Hetu Skanda and Lakshana Skanda, they immediately jump into the Aushadha Skanda and they start with the experimentation with the medicine or medication. That means they give medicine for 15 days, number A, B, C, D, you imagine. And then if he is not getting improvement, they change the medicine with some other medicines like E, F, G. And then also he is not getting the improvement, means then they change some more medicines which are available in the market. They consult or they talk to their friends with the selection of the medicine, and they advise something else and they change the medicine. And during the change of these aushadas, they usually they inform this particular patient that you have to come to the clinic for cure of disease at least for 2 years. आपको आना होगा 2 साल. So that is the wordings which usually they advise or they say to the patient, because so that they'll get enough time to change the medicine. That is not the right way to understand the patient. So always you are experimenting with the medicine with the cost of the patient's money or patient's economy, and you are also playing with the emotions of the patients, and you are not confident that he is going to cure or not. So that is the problem of understanding or dealing with only Aushadha Skanda. And you may ask, sir, you have dealt with the Aushadha Skanda along with the Linga Skanda and Aushadha Skanda. Then also you have not able to give proper result to this particular patient. So in this way, you will have some endpoints to a particular patient. It's just like you are going to a particular place, a new place, with the help of Google Map. and you have a Google map, and you go as directed by the Google map, and one fine point, it says your destiny has arrived, and in reality you are far away from that particular destiny, or you are far away means at least 1 or 2 kilometers away from that particular destiny. Same thing will happen in the clinical practice also. You feel that I am following particular thing like Google map, and I should get this destiny, that is cure of the disease, but in reality you are not getting. You will get these type of patients. At least 50% of this patient in the clinical practice are following or showing this kind of thing, that they cannot be understood by most of the practitioners, whether it is modern or Ayurveda or homeopathy, any system of the medicine. They are beyond our perception. That is, they are not following the Nija Vikara, we can say. Then what I thought, probably this is Agantu Vikara, because he is not showing much improvement in the concepts of Tridosha Siddhanta. I should read, I should follow the Agantu factors which are present or which are explained in the text. So I proceeded in a different way that will be explained later. The theory behind following the Agantu factors, why you have to follow Agantu factors in the clinical practice. It is based on the reference which is explained in Charaka Sharira 6th chapter, which says Deva Vikaraha Samupalabhyanti. Here Deva means it's not like God or something else. Deva means Adrishtam, Daiva, Deva or Divi. All these are considered as Adrushta, or which cannot be seen or perceived directly. They are derived from word Divi or Deva. The word Divi, it is derived from Maya. Maya means a form of illusion, a form of a covering, which is covered. So that is Devadi Vikara. So here also, this particular patient, he is having a disorder which is not so clear. It is covered by something. So that is Devadi Vikara. And how you can understand a disorder which is not so clear or which is covered? He has given 3 points. One is Aptopadeshat. Aptopadeshat means you have to follow the textual references which are explained for understanding Agantu Vikara, that is Aptopadeshat. Then Adbhuta Rupa Darshanat. According to Chakrapani, Adbhuta Rupa Darshana means Na Yat Bhavati Tat Adbhutam. That means Ashcharyam Miti. That is one or a thing which is not going to happen, or one or a incident which is impossible to happen. That is called Adbhuta Rupa Darshanat. And when you see the history of the patient along with the treatment what I have given, you feel that it's quite surprising. That is known as Adbhuta Rupa Darshanat. And then Adosha Prakopa Anurupa Samuthana Linga Chikitsita Vishesha. That is the Hetu, Linga and Aushada or Triskandha of Ayurveda. They are not following the Doshik theory. Of course, here the Lakshana, whatever I have explained in the beginning of this class, Lakshana, it is Dosha Prakopa Anurupa, and Chikitsa, he has not responded. That means Chikitsita Vishesha is Adosha Prakopa Anurupa, and Samuttana Vishesha, though I have read the Samuttana which is explained in Grahani Chikitsa Adhyaya, he said yes for most of the causes. Here, the cause is beyond that. That is, it is beyond the Tridosha Siddhanta. And Samutthana Vishesha Agantunam Agantu Vikareshu Sputa Eva by Chakrapani. That is the Samutthana, Linga and Chikitsita, which are very clear in Agantu Vikara. That is Agantu Vikareshu Sputa Eva. So in Agantu Vikara, either you have a special positive factors, or the Lakshanas are not matching with the textual references, or the patient is not responding to your doshik treatment. So that is Adosha Prakopa Anurupa, Samutthana, Linga, Chikitsita Vishesha. So that is Samutthana Vishesha, Linga Vishesha and Chikitsita Vishesha. Here in this particular patient, Linga Vishesha, it is Dosha Prakopa Anurupa, Chikitsita Vishesha, it is Adosha Prakopa Anurupa, Samutthana or cause for this particular disease, I have to see, that will be explained in further slides. I thought he is following something in the form of Agantu cause or Agantu factor. And that's what I have explained. Agantu vikareshu hetulinga aushada adosha prakopa anurupa. In Agantu vikara, either you get adosha prakopa hetu or adosha prakopa linga or adosha prakopa aushada. And what is dosha prakopa or doshanusara vikara? It is explained in Charaka Samhita Chikitsa Sthana, 30th chapter, like Vasante Shleshmaja Rogaha, Pratah Kshapadu Kafajaha, Vayo Prathame Kafamayaha, Shleshmaja Roga Bhuktamate. That is, the dosha, like Vata Pitta Kapha, they follow certain pattern in disorder, like a disorder. If you imagine that it is a Kafaja disorder, it will be manifested in the Vasanta Ritu, and the symptoms will be more in the early morning and evening, that is Pratah Kshapadu, and the Kafaja disorders can be seen more during the childhood or early part of the life, and immediately after intake of food, Kafaja Vikaras are increasing. So this is a general rule. That's what we have studied in Ashtanga Hridaya. Vayo ahoraktri bhuktanam te antamadhyadiga kramat. So this is known as dosha prakopa anurupa. Here, the patient, though he is showing the lakshana as dosha prakopa anurupa, as the chikitsa is not responding, I should see some hetus which are in the list of agantu factors. So what are the agantu factors? So it is explained in Charaka Samhita Sutrasthana, 7th chapter, in Na Vegan Dharaniya Adhyaya, which says Bhuta Sambhava Roga, Visha Sambhava Roga, Vayu Sambhava Roga, Agni Sambhava Roga, and Sampraharadi Sambhava Roga are considered as Agantu factor. Bhuta Sambhava Roga means it is the Bhuta Vidya, what we say in Samhitas like Charaka Samhita, Sushruta, and Ashtanga, which is known as Amanusha Upasarga Pratisheda or Grahabada. Those are considered as Bhuta Sambhava Rogas, which are considered as produced due to some unknown spirits. And Visha Sambhava Roga, if you study Visha Chikitsa Adhyaya of Charaka Samhita, Sushruta Samhita, you will have certain factors or certain causes under the context of Visha, and those are considered as Visha Sambhava Roga. Then Vayu Sambhava Roga. What is Vayu Sambhava Roga? It is not the Vata which is present inside the body which is causing Vikara. Here Vayu means it is the external wind or breeze which is causing the disorder. Where is the reference? If you see Sushruta Samhita, 6th chapter, he says, Vayuna yatra upahata deshaha vyadihi upajayati. And he is linking directly with Janapadodvamsa Vyadi. That is the context. If Janapadodvamsa Vyadi is present, that means it is produced due to Vayu. You just go through that. I'm not going in detail about that particular Agantu factor, which is explained in Sushruta Samhita. And Agni Sambhava, which is produced due to fire, that is Agantu Roga. And Sampraharadi Sambhava. The word meaning of Samprahara, it has many meaning. One is by injury or hit or assault. The another is, if you see the Sanskrit dictionary, Samprahara means killing or any act which initiate killing. So that is called Samprahara Sambhava. So here Adi is mentioned, not only Samprahara Sambhava, Samprahara Sambhava or act of killing. Here, Charaka, he has not explained anything in the form of Samprahara Sambhava, but if you refer Sushruta Samhita, you will have few references about Sampraharadi Roga. One is in the Vyadi Samuddeshi Adhyaya. He says in the form of Sanghata Bala Pravritta Vyadi, he says Balavat Vigrahaya, Durbalasya Balavat Vigrahaya Vyadihi Upajayati. That is Shastrakrata and Vyalakrata. Shastrakrata means by hitting some weapons, the person is getting some disorder. That is called Shastrakrata, Sanghata Palapravritta Vyadi. And Vyalakrata means because of attack of certain animals like lion or any other animal, that is called Vyalakrita. That is Sampraharadi Samutta Vyadi. Another context in Sushruta Samhita where he is explaining about Sampraharadi Vyadi or Sampraharadi Rogas. It is in the Hitahiti Adhyaya of Sutrasthana. He says about Ekanta Ahita Dravya Prayoga. There are three types of dravya. I'm not going in detail. There are three types of dravya. One is Ekanta Hita, that is exclusively or it is good for all human beings. That is called Ekanta Hita, like Kshira, Madhu, Mudga. These are known as Ekanta Hita. Another is Hita Hita, that is according to the doshic imbalance. For some people, this is Hita. For some, it is Ahita. So that is called Hita Hita. That is depending upon the context or contextual references. Another is the third variety of dravya or third variety of the yogas, which are known as Ekanta Ahita. That is exclusively, these are not good for human beings. So that is a list is given and it is mentioned in a short version like Dahana, Marana, Pachanadishu, Prayokta or Prayogita, Agni, Kshara, Vishadini. That is the application or administration of Agni or administration of Kshara or administration of Visha for Dahana, that is to induce burning sensation for others, or Pachana or something in the form of digestion. Then Marana. What is Marana? Killing. So Dahana, Marana, Pachanadishu, Prayokta, Kshara, Agni, Vishadini. So it is nothing but occult practice. What is occultism? You just go through mail or you just search in Google. You have thousands of sites explaining about what is occult practice. And if you see YouTube also, you have many occult practice YouTubes or occultism. In reality, occultism means it is a tantra, or what we call it as a tantra in Sanskrit. It is of two types. One is Samatantra and Vishamatantra. Tantra is good for protection of the body if it is done properly. That is called Samatantra. And when it is done in an improper way, that is called Vishamatantra Prayoga. That's why in Charaka Samhita, you will have Vishamatantra Prayoga as causative factor for Unmada and Apasmara. It is mentioned. You just go through the text and see. It is mentioned. Vishamatantra Prayogat, Unmada and Apasmara. It is mentioned. So the Tantra or occultism, that is also a cause which is explained in the context of Agantu or Aganturoga. So the shloka goes like this. Ye bhuta visha vayuvagni sampraharadi sambhavaha nrunam agantavo rogaha prajnateshu aparadhyati. That is explained. That is a list which is enlisted with the bhuta sambhava roga, visha sambhava roga, vayu sambhava roga, agni sambhava roga, and sampraharadi sambhava roga. Probably this particular patient who is visiting my clinic after 1 year, he is showing any cause in the list of these. So that I thought, and I started assessing the Bhuta Sambhava Roga, Visha Sambhava Roga and all. Then I, before that, there is some theoretical portion I have explained here. You just go through that. I'm not going in detail. Sarva eva nija vikara nanyatra vata pitta kafebhyo nirvartante. In the doshic disorders, there is no question that vata pitta kapha are not present. That is, invariably they are present in a nija vikara. Agantavo tato vishishtaha. Agantu rogas, they are excluded from this rule. That is, vata pitta kapha vyatiriktaha, as told by Chakrapani. And in the our teaching institutions and in our clinical practice, we have orientation to see only the Tridosha theory. Whenever we go to seminar or any discussion, we think or we discuss about only the Nija Vikara, or we discuss about Tridosha Siddhanta, and we get a conclusion that we say, if you give this administration or administer these medicines, definitely he is going to cure. But sometimes it is not possible. And the confusion to understand Agantu Vikara is the Agantu Vikaras are more or less similar to Nija Vikara, or like Nija Vikara only. That is Agantuhu Anveti Nijam Vikaram Nijaha Tata Agantum Api Pravrintaha. That is, there is a close association of Nija and Agantu Vikaras. Agantu Vikara doesn't mean that the person is suffering from some mania condition, or person is suffering from something in the form of Agantu Unmadam. So we have a wrong notion in the clinical practice. But a disease which looks like a Nijavikara, but the causative factor is something in the form of Agantu, that is also possibility in the clinical practice. That's why Charaka says, Tatra Anubandham Prakratincha Samyak Jnatva Tatha Karma Samarabheta. It is explained in Charaka Samhita Sutrasthana 19th chapter. That's why you have to see Anubandha. Anubandha means it is whether it is a Swatantra Vyadi or Paratantra Vyadi. If it is a Swatantra Vyadi, then you have to see whether the cause is dosha or whether the cause is agantu. Here, the person exhibiting the Swatantra Vyadi Lakshana and cause is of agantu Vyadi. Then Prakritincha Samyak Jnatva. Prakriti means it is Vikara Prakriti. It is already explained in the previous class what is Vikara Prakriti. So that you have to assess and then you have to start the treatment. Tataha Karma Samarabhetam. So in this particular patient, you feel that this is a challenging patient. He is not getting result with the treatment. Then I start assessing Agantu factors, and then Agantu factors are assessed. I opened a particular chapter of Charaka Samhita. I asked whether you have paleness of your face or body, or some people, did you experience that people ask you whether why you are showing so much of dullness or so much of paleness in your expression or in your face? Then he said, yes, many of them have asked. That is nothing but Panduta or Pandu. It is different from Pandvamaya, which we have discussed in the previous class. Here the symptom is only Pandu or Panduta. It's not Pandvamaya. And Krisha, the body weight is reduced. And Alpagni, that was told by the patient. And Marma Pradhamana. Pradhamana means it is a pricking type of pain in the marma, especially in three marmas like Hradaya, Basti and Shiras. He is having pain in the Hradaya marma. Then Adhana, bloating sensation or bloating of the abdomen, that is present. Grahani dosha as already present in this particular patient, and Gulma, pain abdomen, that is also there. Then after asking these questions, then I asked, did you experience or do you experience some form of dreams? He said, yes, quite often I experience dream, and I cannot understand what it is, but I can see something like my facial color, it is changed, or I have a different complexion that is experienced. He said like that. And he said his sleep is disturbed. It's not a proper sleep. It's not a normal sleep. The quality of the sleep is disturbed. These things are appreciated by the patient. And then you may ask, where is explained these particular symptoms? Then it is explained in Garavisha, which is explained in Charaka Samhita Chikitsasthana, 23rd chapter. If you see shloka number 234 to further shlokas, you will get the symptoms of Garavisha Lakshana. It says, Garavisha Hetu, why Garavisha will causing problem for a person. It is mentioned, Saubhagyartham Striyaha Sveda Raju Nana Angajan Malan Shatru Prayuktamsha Garan Prayachanti Annamishritan. So there is a chakara in Shatru Prayuktamsha. So there is a chakara. There are two Kriya Padas. One is Saubhagyartham Striyaha Svedo Raju Nana Angajan Malan. That is the first part. And second is Striyaha Shatru Prayaktamsha Garan Prayachanti Annamishritan. That means the second part, it is administration of Visha or Garan. Gara means it is a synonym of Visha. If you see the Amarakosha, Gara is synonym for Visha. That is Garan Prayachanti means they put poison which is mixed with food. That is Anna Mishritan. And how these ladies will get this particular poison, that means the poison, it is supplied by enemies, that is Shatru Prayuktamsham. They give it to a particular lady who is serving the food to a particular person, and that is mixed with food and it is given. So that is Garavisha Prayoga. And first one is Saubhagyartam Striyah Sweda Rajo Nana Angajan Malan. That is, it is in the form of occultism, where the waste product of her own body, it is added to the food and it is given to the person. And if you see the commentary of Gangadhara in Jalpakalpadaru on the same shloka, he says the first line, it explains Vashikarana, again a form of occultism. And second line, Shatru Prayuktam Shagaran Prayachanti, that is Visha Prayoga. So either you have Garavisha Lakshana in the form of Vashikarana or in the form of administration or adding of Visha. So that is Garavisha Prayoga or Vashikarana Prayoga. And immediately when the person is saying yes for many of the symptoms of Garavisha, what Charaka says, Tam Aveksha Prajnah Vishak Prachet Kim Kaihi Kadasah Jagdam Iti. When you get the maximum symptoms of Garavisha Prayoga, then you have to ask the patient where you have taken food, or with whom you have taken food, or who served you the food. Those things should be asked. That means the doctor or physician will get an idea that he is poisoned by this particular person. So that was the context which is explained in the Charaka Samhita, which is like long back. So here, when I asked these things, he is not having much idea about this. He told, I can't say because I am working in a temple, and every day, I'll meet so many people, and even when I am taking food, I'll be served by different people, not only 1 or 2 person, because in that particular temple, they serve food around 10,000 people in a day. So it's not so easy to detect a person who is serving you every day. So he said, it's not possible for me to trace out who is having or who is behind this particular action. Then I said, you take a reference or you take a like second opinion of astrology or Indian astrology. And he consulted an astrologer. He said, there is a chance of Garavisha Prayoga, which is known as Shvelana Yoga, which is a direct sign of poisoning. He said, you probably particular time around 2018, you are poisoned by a particular person or a particular lady, he said. Then I said, okay, we will take it as a remote cause because or a remote reference. We have direct reference in the text. Charaka says that it is either it is Garavisha Prayoga or Vashikarana. And what is Vashikarana, how it is done and all, you just go through Google. I'm not explaining those things. Those are the occult practices and occultism, and it's not the platform to explain those things, but that is happening or that is there in the society. Such practices may cause disorders to a person. So that is the intention to explain these things. And I diagnosed it as Garavisha, and Garavisha Chikitsa is planned. And again, the treatment of Garavisha, it is explained in the text, and the textual references are followed. Vishak Ashu Vamanam Pradadyat. Immediately you have to administer Vamana. And here also, just like in the previous case, no Snehana and Svedana is performed because Vishagararditam Asnehyaha, it is told. That's why Snehana and Svedana, it is not performed. And what Charaka says, Sukshmam Tamrarajaha Tasmai Sakshaudram. For administration of Vamana Karma, it is not the Madana Falakashaya. You have to use tamrabhasma in a small quantity, then along with the honey and some form of decoction you may give it, and then the person will get vamana. And if you read Rasa Shastra, it says na visham visham ityahu tamram visham uchate, etc. The tamra is considered as a visha, a potent visha. And when tamra is administered in a small dose, a dose of 125 mg, along with the kshaudra and water, the person will develop vamana around 8 to 10 times what I have seen in the patient. And based on that, I have administered tamrabhasma, a dose of 125 mg, and then it is mixed with the honey, little quantity of honey, and along with the plain water, it is mixed and it is given. And again, vamana karma is performed. Again, samyak vamana lakshanas are seen. And then shuddheradi hemachurnasya dapayet. And after samsarjana krama, after 7 days, then Swarna Bhasma, it is administered in a small dose, and Shuddheradi Hemachurnasya Dapayet. So continuous administration of Hemachurna for 21 days, it is administered. It is mixed with some other dravya and it is given. And the reference in Charaka Samhita, in Chikitsa Sthana, it says, Hema Sarva Vishani Ashu Garamscha Viniyachati Na Sajjate Hema Pangi Visham Padmadale Ambuvat. When you administer Swarna Bhasma in a small dose, then Garavisha will be removed very quickly. And again, if there is chance of Garavisha Prayoga, or there is if there is chance of repetition of Garavisha Prayoga, then the second Garavisha Prayoga will not act, or further Garavisha Prayoga will not act. That is just like when you put water over the leaf of a lotus, immediately there will be sleeping of the water droplets. Similarly, the Gara will not stay inside the body. So that is the reference which is explained in the same context. That's why Swarna Bhasma Prayoga at a dose of 1 gram per month. So that is given. So it is calculated for 21 days and it is administered along with the medicines, other medicines in the form of powder, and it is continued for 21 days. And after that, a Mahishagrata or Garahara Mahishagrata, which is explained in Charaka Samhita in the same context of Gara, where the grata of buffalo, it is taken and it is processed with some of the dravyas which are explained in Charaka Kalpasthana, like Nagadanti, Trivrat Danti, Dravanti, Snukpayaha, Palaihi. Palaihi means Madana Palaihi. And the grata, Mahisha grata, it is processed along with Gomutra. And then when it is administered, it is mentioned for, it is indicated for Gararthanam, that is Sarpaketa Visharthanam Gararthanam cha Shantaye. It is explained in Charaka Samhita Vishachikitsa Adhyaya. After 21 days of Swarna Prayoga or Swarna Bhasma Prayoga, Mahisha grata, it is prepared and it is given again for 21 days. And during the administration of Mahisha grata, the dose it is only in the morning it is administered around the dose of 20 ml per day, because here in South India, the patients are not so accustomed for intake of grata. That's why in a small dose it is given for a longer duration as a Shamanaushadha, and even with the dose of 20 ml per day in the empty stomach, he was developing Virechana for 3 to 4 times, and after that he was showing improvement, and now he is free from the disorder. And when I had to administer Vamana Karma with the help of or with the use of Tamra Bhasma, it was very difficult to convince the patient that I have to say I am administering Vamana Karma means what he was thinking is, what is the logic? Vamana Karma is already done last year, then why it is again it is important? Then I said, see, the context is entirely different. In the previous context, it was administered with some other medicine for thinking some other area. And now the context is entirely different. It is coming in Agantu factor, and the Visha is the cause which is lying behind it. And this is the treatment what I have to follow. And after that, I have to make these treatments. Then he said, okay, I have no option. Whatever you say, I have to follow. Then I followed that, and he sincerely obeyed. Then from that particular moment around April of 2020, he is perfectly all right. Now, he is not showing any symptoms of Grahani dosha, even though he is working in the same place. He is continuing his work even after that. So he is working in same place, but he is not showing any problem or any symptom related to Grahani. So this is how you shift from Agantu Vikara to Nija Vikara or Nija Vikara to Agantu Vikara. If you are not getting expected result with your proper diagnosis based on the textual references, thinking that this is a pure doshic theory which is acting behind that, sometime the patient is showing the symptoms beyond that in the form of Agantu factor. So here, this particular patient, the Agantu factor that is present in the form of Visha Prayoga or Garavisha Prayoga, and how it is administered, with whom it is administered, these things were not asked and these things were not assessed, because it was not possible for me to assess those things. But the astrological consultation, it shows some hint that there is possibility in this particular period that he is going to be poisoned. So that was there, and based on those references, I administered Garavisha Chikitsa, and then he showed the improvement. Now he is not taking any medicine for Grahani dosha, and I cautioned him that you follow strict diet, because every time if Agni is disturbed, you may get some symptoms which are similar to the previous experiences. Then he said, no, okay, I follow your strict instructions, and he's following that. Now he's free from the illness. So this is what I administered in a summary. That is Agantu Hetu. It is a Garavisha Prayoga. Garavisha Lakshanas are there. If you see the Charaka Samhita, Chikitsa Sthana, it mentioned Saubhagyartham Striyaha and all. Then Taihi, Panduhu, Krashaha, Alpagni, Marma Pradamanam, Admanam, Shayatum Hastapadayoho. Those references are there. And Grahani and Gulma, those features are present. Then Garavisha Chikitsa, it is in the form of Vamana using Tamra Basma, and after Vamana Karma, Swarna Basma is administered, and then Mahisha Grata, it is administered. So with this form of treatment, he showed maximum result. But in the clinical practice, we are not showing much importance for understanding a patient. When he says or he is saying that I'm not getting any result, that means immediately we think that he is suffering from some mental disorder, because we have studied some modern theory in Ayurveda when we are studying Ayurveda. Like whenever the person is in a deep stress or when person is anxious, then there is possibility of a disorder. That is the theory which modern medicine says. And we follow the similar pattern, says that he is having some stress. That's why these causes or the disease is triggering. But in reality, in the society, you will have many or n number of causes which are in the form of Agantu. Only one Agantu cause in the form of Garavisha Prayoga I have explained here. I have seen many of such Agantu factors in the patients, and I treated accordingly. It's not like I followed Tridosha Siddhanta. It doesn't mean that Tridosha Siddhanta is not at all important. And one more thing with the I'll stop within 5 minutes. One more thing which I am going to explain, that in Charaka Samhita, 19th chapter of Sutrasthana, the Charaka says the Tridoshas are very important in Nija Vikaras, just like a bird flying in the sky during daytime. What does it mean? It means he is explaining only 50% of the possibility or 50% of the probability. A bird flying in the daytime, it cannot escape its shadow which is falling on the earth. So that is the relation between the dosha and nija vikara. What about a bird flying during night? That is the 50%. If you take 24 hours, 12 hours will be day and 12 hours will be the night. And here the author is explaining only the 12 hours of the day, that is 50% of the condition for Tridosha theory. And what is untold, what is called Anukta Paribhasha or Uhya Tantra Yukti in that context is, there are some disorders which are like a bird flying during night where the shadow is not falling on the ground. That means they are escaping the Tridosha theory. So that is the nidarshana which is explained in the text. Similarly, in the clinical practice also, we have the 50% of the patients who are following or who are exhibiting the Tridosha theories, and when you give the medicines, they will respond. When they are not following or when they are not exhibiting Tridosha theory, just like a bird flying during night, there is no relation between Tridosha and the Vikara. Similarly, they are following the Agantu factors. Then you should trace Agantu factors. Then you will get some idea, then you can treat it. This is how I select Daiva Upashara Chikitsa or Yukti Upashara Chikitsa. That is the base to understand whether Daiva Upashara Chikitsa is needed or Yukti Upashara Chikitsa is needed. Of course, Sattva Avajaya Chikitsa is also important, but the selection of Daiva Upashraya or Yukti Upashraya, it depends upon the presence or absence of Agantu factors. If Agantu factors are there, then definitely you go towards the Daiva Upashraya Chikitsa, because most of the Chikitsas in Agantu, it is in the form of Bali, Upahara, Dhupa, etc. When you read the Samhitas, that we will discuss in the next or the future classes. That's how the Yukti Upashraya Chikitsa is important, and simultaneously Daiva Upashraya Chikitsa or understanding Agantu factors are also very important. With these explanation of a same case in 2 years, that is 2019 and 2020, I'll conclude this particular talk. If you have any doubt, then you can ask.
Yes, thank you, sir, for your very nice lecture. If you have any question, you can ask. I think that Vaishali Anjali is asking some question. I am unmuting. Yes, Vaishali ji, आप पूछ सकती हैं. Unmute कर दिया मैंने.
Sir, COVID-19 is also Agantuk Vikara. And you said that Agantuk Vikara, we should think about Daiva Upashraya Chikitsa.
Yeah.
How will you see it and how will you think about treatment giving?
Yeah, yeah, good question to the context. You say, I said that the COVID-19 or Janapadodvamsa Vikara, what we are experiencing now, is considered as Agantu Vikara produced by Vayu, that I said. And then what is Daiva Upashraya Chikitsa? You just open Charaka Samhita. There are many Daiva Upashraya Chikitsa. If you want, I can read and explain you. That is explained in Vimanasthana 3rd chapter, which says about the first one is about Guptihi Atmanaha. Guptihi Atmanaha means, if you see the Chakrapani commentary, it is Mantradina Raksha. That is, with the help of chanting some mantras, you can protect your body. That is the Atma, that is mentioned in the Chakrapani commentary on Guptihi Atmanaha. Guptihi, it is mentioned in Chakrapani commentary, and it is mentioned in the main shloka also. It is in the shloka of in the context of Vimanasthana 3rd chapter, and in shloka number 15, that it says Sadvratyasya Anuratyascha Prashamo Guptihi Atmanaha. Guptihi Atmanaha means you have to protect your energy with the help of chanting some mantras. And you may ask, which mantra I have to chant? So that is a question for Ayurvedic people. But if you have constant touch with the people who are having connection with the puja and all, then you will get an idea that this mantra or this particular thing I have to chant. So that is it individual. It is an individual specific thing. Then when you do that, you will be free from, or you are protected from the Agantu factor or COVID-19, what Charaka says. And then it is mentioned like Sevanam Brahmacharyasya, Tataiva Brahmacharinam and all. Here Brahmacharya means the context in the other or Vedanta. Brahmacharya means it is reading of Veda also. That is Brahma means it is Veda. Then Sankata Dharma Shastranam, reading the Dharma Shastra context. That is also like in the form of Daiva Pashra Chikitsa. Then Dharmikaihi Satvikaihi Nityam Sahasya Vradha Sammataihi, company of age-old people or those are known. These are considered as Daiva Pashra Chikitsa in this particular context. And you may ask, who is following this? That's a question. And we are not giving much importance to those things in the present scenario. But when it is done in the form of Bhagavata Saptaha and all, for a community which is practiced here in the areas of Karnataka, the people feel that they are having something in the form of a positive support to the present situation, because that gives immense support to the present condition that can be followed. So here the Daiva is not like Bali, Mantra, Mangala, etc. Here the other areas of Daiva Chikitsa is too.
Jain ji, you are asking your question, hand raised. Please ask your questions. Yeah, Vinod Jain ji.
नमस्कार,
नमस्कार.
मैं डॉक्टर विनोद जैन चंडीगढ़ से. आपने बहुत ही एक ऐसा एस्पेक्ट खोला है जो बहुत से वैद्यों से अनभिज्ञ है, and thanks for that. Secondly, whenever such patient comes, if you are dealing in a particular type of practice, Ayurvedic practice, then you must consult the horoscope of the patient.
Yeah.
And then accordingly, the Rashi of the patient and mantra for that, if prescribed to the patient definitely gets help. That is my view, and I am practicing it also.
Yeah.
Thanks for the very elaborative lecture.
Okay. You asked about, you told about the astrology and the consultation, its impact on Ayurveda. Here also, I am doing that. But when you ask my background, family background, few of my uncles, few of my grandfathers, they were astrologers. And even I am in a I am in a position, I was there in a position to study astrology, but around the year of 2005 or so. But intentionally, I left the idea of studying astrology, Indian astrology. I have idea about Indian astrology because that is there in my family. Every time I am in contact with those people. But intentionally, I stopped studying astrology. The reason is, when you study Indian astrology or Jyotisha Shastra, you forget to read Charaka Samhita or Sushruta Samhita, thinking that is so easy. When you study astrology, it is just like mathematics. If it is there, you will have this problem. And then the idea of Ayurveda, like study of Charaka, Sushruta, it will go behind. You are not showing much interest to that. So I just avoided studying Indian astrology. Just I have to study more about Charaka and Sushruta. That's why I have not studied much about Indian astrology or any astrology. But that is useful. That whatever you said, it's right. But in my point of view, when you study astrology along with Ayurveda, you go more towards astrology than Ayurveda. That what I have seen many of the practitioners who are practicing in Udupi. They studied astrology. They have studied astrology in depth. And then they are practicing astrology and they stopped practicing Ayurveda. So to avoid that particular situation, I have not studied astrology, but that's useful.
No, I am a teacher here in Dhanvantari Ayurvedic College, professor in
Okay.
Shalakya Tantra.
Okay.
And second thing is that astrology is an help, not a particular branch to deal with everything. That provides me insight into the drug, which drug should be used for this patient.
Yeah.
Because many plants are related to all the rashis
Yeah.
and nakshatras. So a particular person born in a particular nakshatra, if prescribed the same medicine or same medicine is used for the person, then person definitely gets help. That is my view.
Yeah, definitely. That is there. I don't deny your idea. But when we study astrology and when we advise in that way, the study of Samhitas will go back. So that's why I'm not studied. That's my thing, what I have said. But whatever
No,
you
no.
said is right. It's right.
I am studying Susha, Charak and Vagbat also. But
Okay.
I said that is a help to me.
Definitely it will help.
So very good lecture. Thank you.
A very good lecture, sir. So thank you, sir, Professor Udupa, sir. So very nicely explained. So last, I take question from Madhuri Gole as the next lecture is pending, and as Dr. Sayan S. Nair from Puducherry is also joining for his next lecture. So
Okay,
Madhuri
okay.
Gole,
Hello, sir.
what is your
Yeah.
This
question
is
you can
Dr.
ask?
Madhuri Goe from
Yeah.
Mumbai. Sir, how did you use the Tamra Bhasma procedure in Vaman? Sahasraputti did you use or what kind of?
No, the thing is like I'm not preparing any basma in my this one pharmacy because I'm preparing only the cast aushadhi in my pharmacy. Whatever the medicine I procure in terms of Rashastra it is from my friend who is known as Dr. Gopi Krishna, who is from Bellary. And whenever I get something Rashastra drug, I'll call him and he'll advise me. This is the thing which you have to give.
Sir,
Then
but what's the procedure? How did you use in Vaman? Vaman procedure.
it is there in the text. It is. I told no. It is mixed with the like honey, and it's
Yes.
mixed with the plain water, and it's given. That's all.
Okay.
Yeah, it's not
Only
like
once, only once only you are
once.
given.
Yeah,
Okay.
only once, and you have to wait for some 1.5 hours, not like 45 minutes or so. It will take some time to
Okay.
induce vomiting. So
And
I'm-
what?
Yeah.
And sir, one more question. What was the diet then you advised? He was eating outside only, that
No,
patient.
no. He's not eating outside. Like
Okay.
he is a priest, and
Hmm.
he is following a diet. Previously, he used to take 3 times in a day, like morning, afternoon, and evening in his home. And when he was appointed for a particular purpose in the temple,
That
Udupi Krishna Math, he used to take food twice daily. That is around 11 o'clock in the morning, or 11:30 to 12 in the morning, and night around 8 to 9. In between 8 to 9, he used to take. So that was the problem. One more is in the temples, they use more or less like similar vegetable every day. Only few they have permission to prepare the food, few vegetables. So those were the problem. It is not like he's
Okay.
taking outside food.
Okay. Thank you, sir. Thank you.
So thank you, sir, for your beautiful lecture. So it's our pleasure that you have given the second lecture on your series. So so third lecture, what is the third lecture you can announce to our participants? Yeah.
Definitely, I'll.
So save the time at the Sunday next week. Again, Professor Udupa will be here. Just he's announcing his next topic. So be with us and learn the clinical aspect of Charak Samhita, beautifully explained by Professor Udupa.
Definitely, I'll tell the
Yes.
topic which.
Yeah, I have also written.
I'll have this
yeah.
definitely.
But you announce, then it will be good. Yeah.
Yeah, definitely. It's there in. It's there. It is again a continuation of this particular aspect only. It is about role of Daivaparsha Chikitsa in Agantu Roga. It is continuation of the thing what I have explained today.
Yeah.
Based on reference to Grahatrace. Yeah.
Yeah. So this the next series will be the continuation of the same lecture.
Yeah.
So thank you, sir. Thank you for your nice lecture. So now I welcome to the next speaker, Sayan S. Nair from Mahe College, Puducherry. The very beautiful topic, cerebral palsy, principle and Ayurvedic management. and he's a senior consultant at Rajiv Gandhi Ayurveda College, Government of Puducherry, Mahe. And I welcome Dr. Nair sir. I just unmuting you. You can open your camera. आप अपना camera खोल लीजिए sir. You just open your camera. Just I'm making you co-host. Yes, and there is an option of share screen. You just unmute yourself, sir. You are muted. Just yes. Now it's okay. And there is an option in green, share screen. You can just share your screen. तो बहुत ही अच्छा टॉपिक है आज, सेरेब्रल पाल्सी का आयुर्वेदिक मैनेजमेंट. ये आप लोग सब इस सेशन से जरूर जुड़िए. यस, नाउ ब्यूटीफुल सर. नाउ जस्ट फुल स्क्रीन इट. फुल स्क्रीन कर लीजिए सर इसको. स्लाइड शो एंड देन फुल स्क्रीन, देन इट विल बी ब्यूटीफुल. या इधर स्लाइड शो का ऑप्शन है सर, या ऊपर. या नाउ इट्स गुड सर. ओके फाइन. So welcome Dr. Sainas Nair sir in the Ayush Darpan Sunday special session. As you are MD in Ayurveda and PhD in Balaroga and assistant professor and senior consultant at Rajiv Gandhi Ayurveda Medical College and Hospital, Government of Puducherry, Maharashtra, Mahe. So I welcome you. And cerebral palsy is a very beautiful subject, beautiful topic which you have selected. And I hope that the Ayush Darpan Journals doctors will enjoy this lecture, Sunday special lecture. ये हमारी प्रयास है हमारा कि हम आपको वेरिएशंस ऑफ एक्सपर्ट से मिलाएं. दक्षिण भारत के अभी आपने रघुदीप जी से, अभी प्रोफेसर उडुपा साहब के आपने इतने ब्यूटीफुल लेक्चर सुने. अब आपके पास साइनस नायर जी आ गए. सर, you can continue your lecture as the time is no limit. You can continue it up to 1.5 hours, and then for 15 to 20 minutes. We will take a question answer session. Professor Udupa is also here, so you also can enjoy the lecture. Thank you. Start, sir.
Thank you, sir. I think I'm audible to all.
You are audible.
Okay, fine. Thank you. So, without any much introduction, I'm directly coming to the topic. First of all, let me thank our Ayush Darpan Foundation and Dr. Naveen Joshi, sir, for doing such wonderful work in Ayurveda. So anyway, there is a say, so the knowledge, let it come to this point. Okay. So anyway, directly I'm starting with cerebral palsy, principles and Ayurvedic management. The slide is visible and I'm audible for each and every one, right? Hello.
Yes, sir, you can continue. Okay, it's okay.
Okay, so the cerebral palsy, principles and Ayurvedic management. So let us see what is cerebral palsy. Whenever we speak about cerebral palsy, see the maximum disabled children will be coming in the disability maximum upon cerebral palsy in the pediatric age group. So these are the few questions it will come to our mind when we speak about cerebral palsy. What is cerebral palsy? Who all are susceptible for cerebral palsy? These all questions I will be answering now. So what is meant by cerebral palsy? Cerebral palsy is nothing but it is called a status encephalopathy. Status encephalopathy. It's very important. The term itself states status stands for non-progressive. It is non-progressive neuromotor development disorder. So when I am saying it is non-progressive neuromotor development disorder, almost all the progressive and degenerative disorders will not include in the terminology of cerebral palsy. And also few metabolic causes of nervous system that also will be excluded from the diagnosis. And it is the commonest cause for childhood disability. Almost 15 to 20% of the childhood disability is cerebral palsy. And if you see the prevalence of the disease in India, the incidence is 3:1,000 live birth. In 1,000 live birth, 3 children are suffering with cerebral palsy. So it's a burning issue. Okay. So why it is happening? Again, because of anoxia or hypoxia, which is occurring at the time or in the antenatal period or in the natal period or in the postnatal period.
There is some sound is coming from outside.
So you can mute them, I think. I think you can mute them.
Vicky Thakur ji,
Okay, thank
please
you.
unmute yourself.
Thank you. So who all are susceptible? Again, next question one comes, who all may suffer
Muting.
with cerebral palsy?
Sir, unmute yourself, sir. Unmute yourself. 1 minute, sir. Unmute yourself.
Okay,
Yeah,
fine, fine.
yeah, okay. Yeah.
So the second question is, I think cerebral palsy, it is clear. So the second question will be, who all are susceptible? When we are sitting in the clinic, if you know some basic clues, it will be easy for the diagnosis. Because why I am saying it's for clinicians, still I am saying roga madho parishit tata naundaram aushadam. First, we should have a general knowledge of the disease. We should come to a diagnosis. Then only we should think about the treatment aspect. So who all are susceptible means, again, preterm babies. Why preterm baby or low birth weight babies? Because their systems are immature. Because of a immature system, there is chances of IRDS, idiopathic respiratory distress syndrome. In turn, it may cause anoxia or hypoxia in the brain. Suddenly, there will be damage to the brain, or the term is called periventricular leukomalacia. The outcome will be cerebral palsy. And next, abnormal posture. Abnormal posture, whenever the child is having an abnormal posture, so normally the gynecologist may use vacuum or forceps. So it may cause again hemorrhage inside the brain. So the outcome again neurological damage and neurological sequelae, and the outcome will be cerebral palsy. And next, post-term deliveries. Post-term delivery, it's very important. Normally we think once the baby is term or post-term, there won't be any complications. If it is term, when we are saying term, 37 to 41 weeks, if the age group, if the gestational group, then it is normal. If it is more than 41 weeks, it is said as 41 weeks, it is said as post-term babies. Post-term babies, there is chances of meconium aspiration, and the outcome will be again respiratory distress or hypoxia in the brain, and the outcome will be cerebral palsy. These are the causes which or pathology which is, or susceptible babies which is happening, which is getting cerebral palsy. So moving on to what cause cerebral palsy. So what is happening? First one is cerebral dysgenesis. Cerebral dysgenesis. Any sequelae or any insult at the time of first trimester. First trimester means it is first 3 months. It is said as first trimester. Or you can say in other words, first 20 weeks. It is very crucial because it is a period of organogenesis. Organogenesis, organs will be developing in this time. So a simple viral infection or any sort of insult to the growing child, it itself may produce a abnormal organogenesis. If it is happening in the cerebral area, that is called cerebral dysgenesis, the outcome will be cerebral palsy. And next, in preterm babies, this pathology is very common. Periventricular leukomalacia. Just now I was saying periventricular leukomalacia means inside the brain there is a cavity called ventricle. Inside that CSF will be there. Peri means outer to the ventricle. There is white matter. So this white matter will be injured because of hypoxia. Again, the outcome will be a cerebral palsy child. Next is hypoxic ischemic encephalopathy. The word itself is self-explanatory. Hypoxia, which is leading to ischemia, and which is leading to encephalopathy. Encephalopathy means damage to the brain matter. So this again, if the child is suffering with hypoxia leading to ischemia and a complete damage to the brain, later phase the child will be suffering with cerebral palsy or neurological sequelae. And next is intracranial hemorrhages. I told that when the mother is, mother was having CPD, because of that they have used the forceps or a vacuum extraction. So a difficult labor, the outcome will be a cerebral hemorrhage. And cerebral hemorrhage, it may cause injury to the brain matter, and the outcome will be again cerebral palsy or a neurological or a motor impaired child. Okay, so next and last cause is kernicterus. Kernicterus, you must have heard about icterus. When it affects the ganglions, basal ganglia, neurological cells, it is called as kernicterus. So kernicterus, when the child is having pathological jaundice, you heard about neonatal jaundice. It is of two variety, physiological and pathological jaundice. So if the pathological jaundice is affected to the child, or the child is suffering with pathological jaundice, and again, if it is not treated, if the bilirubin is raising more than 18 to 20 mg per dl, again, it may enter into the blood-brain barrier, and it may stain the basal ganglia, and the outcome will be a neurological sequelae children. Okay, so let us see when to suspect cerebral palsy. So these clinical features, mainly these are the clinical features. If you see these features in the growing child or a first infantile period means from birth to 1 year, and first neonatal period is early markers are there, we will come to it. This entire 1 year period, you can see these all features. They are called clinical features of cerebral palsy. Abnormality of posture, that is very important. There will be abnormality of posture. It may be because of an abnormal muscle tone, hypotonia or hypertonia. Okay, hypotonia or hypertonia, increased tone or a decreased tone. There will be abnormalities in muscle tone and abnormality in movement. Abnormality in movement means, when I speak about subtypes of cerebral palsy, there are choreo, athertoic, these all varieties of cerebral palsy. So chorea is an involuntary movement, athertosis is an involuntary movement, and sometimes the child will be having seizures. So these all are involuntary movements. And abnormality of reflexes. Abnormality of reflexes means, you know, the cerebral palsy is the upper motor neuron lesion. Upper motor neuron lesion. So upper motor neuron lesion, normally it will present with exaggerated reflexes, exaggerated deep tendon reflexes, and you will get a positive response of Babinski sign, that is plantar reflex. Plantar reflex, you will be getting a positive response. So these are the reflex changes you will be getting, and of course it will be having a delayed development. Delayed development means the development will be, or the growth and development will be assessed under two subheadings. One is anthropometry and second one is developed screening test. Screening test, again, it is having 4 subcategories like motor, fine motor, gross motor, language, and social development. So these 4 criteria, if it is affected up to 1 year, you may call it as global development delay. Or if only language is affected, you may call it as only language delay. Okay, and only after 1 year, only after 1 year of age only, you will name it as cerebral palsy. Till that, you may call it as development delay. If it is entire 4 areas are affected, you call it as global development delay. So some associated, I told that it's a syndrome. Cerebral palsy is an umbrella term, or it's a syndrome. Okay, it consists of many conditions. So let us see what are the associated complaints. So there will be, before I told that there will be seizures or convulsions associated. So sometimes these convulsions will be more severe. Okay, so speech and communication difficulties will be there. Child will be having some speech abnormality. Which brain, which area is affected? Because entire brain, which motor cortex is the speech area is affected, 100% there will be speech defect. Okay, and there will be feeding and eating defects. That will be the first and most important symptom you will be getting, feeding. And sometimes mother will say that at the time of feeding, child is choking, the milk is entering into the trachea. These all are the early signs you will be getting, because there will be spasm of the epiglottis. So epiglottis will not close properly. So what will happen? The milk which is injected into the mouth, if there is swallowing, sucking and swallowing response together, if it is not happening, there is chances of aspiration leading to aspiration pneumonia and septicemia, the condition worsens. So there is chances of feeding and eating difficulties and sensory impairment in the form of visual and hearing impairment. Sensory impairment in the form of visual or hearing impairment. Normally, cerebral palsy, how to go for Barha test, hearing test, then visual test, eye test, and also almost 90% of the children will be having squint associated squint, or it is called strabismus. There will be ocular, some diverging or converging squint. And few children will be having mental retardation, and few children will be having learning disabilities. If the center of learning area or pyramidal tract is involved, there will be these all features. And few children will be having behavioral disorders. These are the associated complaint you have to think. And let us see the early markers. So moving on to next is, what are the early markers? How we can diagnose the cerebral palsy early? So the early markers are irritability. That is very, very important symptom. In the first and most important symptom, the child will be having, because the brain is under sequelae, brain is under injury, hypoxia. So the child will be having excessive irritability. Because of that, the child will have constant crying. So always remember, a constant crying child, excess irritable child, irritability will be formed in the form, shown in the form of crying. Okay, so and sleep difficulties. Normally, mother will come and say that because they won't accept that the children are having development delay. So they will say that the child is not sleeping well, the child is crying continuously, because almost all the children will be showing cry as the symptom for each and every difficulties what the child is facing. So a expert mother or a trained doctor can understand what sort of cry it is. Okay, this is very important. Excessive irritability, constant crying, and sleep difficulties. These are the first symptoms you will be getting. Along with that, decreased spontaneous activity. Decreased spontaneous activity means, suppose if the child is having hemiplegic variety of cerebral palsy, so what will happen? There will be a primitive reflex called Morose reflex. Morose, M-O-O-R apostrophe S, Morose reflex. It is seeing Morose reflex, there will be unilateral response, or sometimes there won't be any response from the both sides. So this is decreased spontaneous activity will be seen in that children. Then you have to suspect that the child may be suffering with some neurological injury. So asymmetry in posture and movement. Again, asymmetry in posture and movement. That is also very important. And precocious development. Some mother will say that my child started walking at the age of 11 years, 10 years. Because we feel that the normal development will be attained after 13 years only, after 1 month. Because Ayurveda also says, after 1 month only, 1 year only, the child will start walking. Samvalsarat padabhyam gachati. If not walking, it is said as fakka in Ayurveda. Okay, so I'm not going to compare fakka with cerebral palsy. So anyway, I'm saying that if precocious development is there, that is also an early sign. Okay, so poor weight gain, and very, very important symptom, that is constant fisting with adduction of thumb beyond 2 months of age. That is the one main feature you will be getting. Okay, there will be constant fisting and there will be adduction of thumb beyond 2 months of age. That again you have to suspect the child may be suffering with some neurological injury. And delayed social smile. So social smile, that will be the first developments. Gross motor development you will be, or social development you will be getting. So if the delayed social smile is there, again you have to think that the child is having some sort of neurological abnormality. And reduced head circumference. Again, reduced head circumference is called as microcephaly. So normally the head circumference at birth will be 34 centimeter, and the head circumference will be becoming almost 48 centimeter by 1 year, and almost 45 centimeter by 1 year, and 48 centimeter by 2 years. And our adults head circumference, if you see, it will be around 55 to 56 centimeters. So the initial growth and development is very fast. So if the head circumference is not growing accordingly, that also clearly says that the child is having some abnormality. And very important next feature, that is primitive reflexes. They are called primitive reflexes. Some reflexes which are seen at the time of birth. For example, sucking reflex, swallowing reflex, sucking reflex, rooting reflex. Different primitive reflexes should be there at the time of birth. It will not be seen lifelong. Okay, so these primitive reflexes, it should disappear by 6 months. Almost all the primitive reflexes will disappear almost by 6 months, because the subcortex, the corpus callosum, inside the brain you got corpus callosum. Beneath that area is white matter, above that area is gray matter. So the gray matter is, but the nucleus is located. So below the corpus callosum, the matter will be functioning up to the 6 months. After that, suddenly the gray matter will start functioning. So the primitive reflexes, if it persists beyond 6 months, it clearly indicates the child is suffering with some neurological abnormality. So these early markers are very important clinical point of view. If you suspect any, if you get any such sort of abnormalities, you have to screen the child properly for the development. Okay. So moving on to next, types of cerebral palsy. So types of cerebral palsy. So you can see few figures. So broadly, cerebral palsy can be classified into pyramidal and extra pyramidal symptoms. So pyramidal means where the spasticity will be the main feature. Hypotonia and spasticity will be the main feature you will be getting. So these first three figures, you can see there is more the dark area, there is more spasticity in the limbs. So first variety is called as diplegic spastic cerebral palsy. Diplegia, you know, diplegia means two limbs are affected. You can see in the figure where it is marked, two limbs are affected. It is diplegic cerebral palsy. Again, diplegic cerebral palsy main cause will be again periventricular preterm baby. Just now I was saying preterm baby, there will be periventricular leukomalacia. Periventricular leukomalacia means the white matter will be under hypoxia. The outcome will be again diplegic cerebral palsy. Again, mainly it is seen in preterm deliveries, preterm delivered babies. And again, remember, almost 70 to 75% of cerebral palsy will come under spastic variety. This three variety, not only three, one more variety is there. It is first diplegia. This is hemiplegia. You can see that one part of the body, hatvegam, marudam, paksham. Again, one part of the body is affected. So this is called hemiplegia. That is spastic hemiplegic cerebral palsy. And here you can see the four limbs are affected. It comes under spastic quadriplegic cerebral palsy. Quadriplegic. Same way, sometimes what will happen, only one limb will be affected. That is called spastic monoplegic cerebral palsy. These all comes under, so four varieties I told, diplegic, hemiplegic, quadriplegic when four limbs are affected, quadriplegia, and when one limb is affected, it is called, it may be a leg or a hand, which area it is affected, depend upon that, it is called as monoplegia, monoplegic cerebral palsy. So it comes almost 70 to 75% of the cerebral palsy. And next is, this is chorioathetoic or dyskinetic variety of cerebral palsy. Again, it is not so common, but if the child suffer with kernicterus, before I was saying about a terminology called kernicterus, if the child is suffering with some sort of bilirubin increased in the blood, and if it is not controlled, it may strain the ganglions. So because of that, what will happen? There will be a presentation, dyskinetic or chorioathetoic, involuntary movements, the presentation here. And the last one will be hypotonic variety of cerebral palsy or ataxic variety of cerebral palsy. You can see a broad base, mainly cerebellum will be involved in this. If it is called cerebral palsy also, the cerebellar region behind the cerebrum, cerebellar region will be involved. Because of that, there will be a coordination abnormality and there will be difficult gait abnormality will be the presentation. So again, I'm not going in detail about the sub-classifications. You can remember a spastic diplegia. It may be because of a periventricular leukomalacia in commonest in spastic variety. It is hemiplegic variety, and this is quadriplegia, and another one more is there, monoplegia, and it is called abnormal movement of the body or involuntary movement. It is called chorea or athetosis. Chorea or athetosis. This variety is called chorioathetoic cerebral palsy or dyskinetic variety of cerebral palsy. Both are same only. And last one is ataxic variety of cerebral palsy, or it is also called as hypotonic, because entire forelimb there will be hypotonicity. Instead of hyper, in this whole condition, hypertonicity was the presentation. Here it will be hypotonia. And these two are called extrapyramidal cerebral palsy. And the first four are called pyramidal cerebral palsy. So moving on to next, how we can diagnose. There is a criteria called Levens posture criteria. So posture means the full form itself, you can remember. Abnormal posture. These all are very important. Again, 6 features we are giving. Among that 4, if you are getting in the child, you can suspect cerebral palsy. So first is posturing, a abnormal movement. Just now I was saying about chorioathetosis or seizures. So abnormal movement and posturing. Oropharyngeal problems. It may be a swallowing difficulty or grimacing. It may be a swallowing difficulty or grimacing. And next is strabismus. Strabismus is nothing but squint eye. And hypertonia or hypotonia. Next is evolution maldevelopment. Again, I was saying about primitive reflexes. Again, persistent primitive reflex beyond 6 months. Again, that is one main feature you have to remember. And failure to develop equilibrium. That walking gait defects will be also seen. Then reflexes. Again, reflexes will be exaggerated. That means deep tendon reflexes will be exaggerated, and superficial tendon reflexes like Babinski sign or plantar reflex will be having positive response. Among these 6, any 4 you can think about cerebral palsy. So moving on to the comparison of cerebral palsy in our science. So looking into the classification, you can understand that spastic variety, I was saying about spastic variety, hemiplegia can be compared with pakshagata, and diplegia can be compared with pangu. Monoplegia can be compared with ekanga roga, and quadriplegia can be compared with sarvanga roga. If you see that all comes under Vaka. Next, moving on to chorioathetoic variety of cerebral palsy, it can be compared with Kambavata. So if you see that Lakshanas, how our Acharya says, Charaka Samhita, it says Hatvegam Marudam Paksham Dikshinam Vamamevaja. So it's very clearly said one part of the body will be affected. So what our hemiplegic variety of cerebral palsy, think about it, it may be right or there will be Pakshanasha. Okay, Cheshta Nivritti will be there. There will be Cheshta Nivritti. It may be hemiparesis or a paralysis. Okay, Vak Stamba, again, depend upon which area is affected. Suppose if the speech center, higher center for the speech is affected, there will be Vak Stanga. What we said in the contemporary science like communication defects, that same Acharya also explained. And Girhitartham Sharirasya, Sira Snayu, again, Sira Snayu, when it is involved, there will be contractures in the Pata Sankoja and Hasta Sankoja will be there, and when it is affected to one anga, it is called as Ekanga Roga, and when it is affected to Sarvanga, it is called as Sarvanga Roga. See how beautifully Charaka explained this condition. Okay, so looking into the Samprapti Kataka, because Ayurveda very clearly says Samprapti Vigatanameva Chikilsa. So removing the dosha, dusha, samurjana itself is chikilsa. So let us see that which dosha is involved, that is Vata Pradhana Tridosha, and dusha, Rasa, Rakta, Mamsa, Majja. Remember, Rasa, Rakta, Mamsa, Majja involvement will be there for the Samprapti. Srotas, Pranavaha Srotas, Adhisthana again, Mastulunga Majja is involved, Vektasthana, Sarvasharira, Dushta Prakara, again Sangha, again Roga Marga Madhyama, Chiragali, Asadhya. Okay, so I'm not going, remember at least the Dosha, Dusha which is involved in the, and the Srotas which is involved. Okay, so moving on to the principles of treatment, coming on to the principles of treatment. So mainly the motto for the treatment will be reduction of spasticity. I told that spastic variety, mainly hypotonicity will be the difficulty the child will be facing. Because of that, all the development will be delayed. So reduction of spasticity is the first and most important thing, and prevention of abnormal posture. Once if you remove the spasticity, so the abnormal posture will be checked. And promotion of normal milestones. So I will be discussing few cases, further slides. I will be discussing about few cases I have treated and I am treating. So promotion of normal milestones. If with Ayurvedic treatment, 100% you can ensure them that you can attain few milestones with our treatment. Okay, so 100% pure, again Ayurveda very clearly says it's a asadhya vyadhi, but 100% pure we are not ensuring. But if you give 10 to 50% of changes in a cerebral palsy child, or if you make the child as independent, the mother and father will become very happy. Okay, because whenever you see these children, you feel very sad. Mentally and physically, you will be injured by seeing the child. Okay, so anyway, stimulation of sensory and cognitive functions, that is very important. Again, sensory and cognitive functions. If you come and do the panchakarma, that is not only the time you can stimulate the sensory and cognitive. Ask the mother to do it daily ways. Sometimes mothers will think the speech therapist or occupational therapist, they are doing. No, they are doing only for one day. Entire day the mother will be staying with the child. So we used to advise mother, you have to stimulate the child each and every time whenever they are free. And training in activities of day-to-day life, and treatment of associated problems. I told that few associated problems are there, treating associated problems, and prevention of deformities and contractures. Again, very important. Once the contracture or deformities are developed, contractures develop means there will be clonus formation. If you see that angle, the tone will increase. Because of that, there will be clonus formation. Once if it is there because of a spasm of or hypotonicity of Achilles tendon, sometimes you have to send the child for surgical correction. So we should prevent that condition. So prevention by our treatment, we can prevent that. Okay, anyway, these are the principles. Once more I am saying: reduction of spasticity, prevention of abnormal posture, promotion of normal milestone, stimulation of sensory and cognitive function, training in activities of day-to-day life, treatment of associated problems, and prevention of deformities and contractures. So moving on to our principles of treatment. Our principles of treatment, what we do, that is Vata Chikitsa. Vata Chikitsa, what Acharya said, Kevalam Nirupastambam, that is very important. We should make the Vata Kevala Vata. It is very important. If it is a Avarana Vata, if it is having Anya Dosha Samsarga, it should be treated first. So Avarana, normally children will be having Avarana or Amatwa, it should be corrected first. Normally we advise Kashaya Yogas for a period of 1 or 2 months. After that only we plan Panchakarma. So by that Rukshana you can do, or after admitting you can do Rukshana Kriya. Anyway, Kevalam Nirupastambam, it is very important. You should underline that topic. And Sneho Rupacharets. Again, Sneha Karma are done in almost all the Vata Vikaras. And Anuvasanam, again very important. Basti is said as main chikitsa in Balya Avastha. Kesha Naga Agrabhyam Basti Brahmir Naram. Very clearly Kashyapa says that from it is having from Kesha to Naga Agra, Kesha Naga Agrabhyam Basti Brahmir Naram. And also he says that Shishunam Ashishunam Basti Karmam Amrudam Yata. It is like a nectar. It is like a nectar. So you can blindly adopt Anuvasana. So whatever Basti, it may be Anuvasana or Nirupa Basti. Again, he says Turbalo ya Avirechya. If the child is not Yogya for Virechana, then one can go for Nirupa Basti. Again, Ashtanga Hridaya, if you see that the treatment principle also, he says that Basti Sadhyo Virekena Marshena Pratimarshana. Very clearly he says Basti Sadhyo Virekena. Basti is the line of treatment again if you want to adopt Virechana. So it can be a Vairejanika pasti. And next he says Marshena Pratimarshanam. If Marshanasya, if you want to adopt, go for Pratimarshanasya, it will give equivalent result. Again, if you see Charaka Chikitsa, he says when Asti Majja Gate, when Asti and Majja is involved, he says Bahya Abhyantara Sneha is specially indicated. It may be in the form of Antarika Sneha, Snehapana, or it may be the form of Chamananga Sneha, or it may be in the form of Abhyanga Bahi Sneha. And also, if you see Vadasya Upakrama, he says Brahmana, Sandarpana Vyadi and Apatarpana Vijanya Vyadi. So Sandarpana is the line of treatment for Vata Roga. And these are the principles what we are adopting in our clinical practice. Because without theory, if you treat the condition, there may not be much result. So based on this treatment principle only, you have to adopt or plan a treatment. Again, he says Shiro Gate, Shiro Basti. Again, Shiro Basti is practically speaking, doing in pediatric age group, it is impractical. So normally what we do, we may go for Murthini Tailas like Shiro Thara, Shiro Pichu, Tala Potichil, then Talam. There are few preparations like Tala Potichil and Talam, which is specially practiced in Kerala. Because in the host told that I am basically from Pondicherry, no, I am from Kerala, because the Mahi comes inside Kerala, near to Kannur. So I'm staying here in Kerala. So we adopt Kerala Chikitsa like Tala Potichil or Talam. So these all are again instead of Shiro Basti we may be practicing. Why again normally we are speaking about all the Sneha Drivya. So normally there will be a doubt that again why Sneha is given more importance. See, if you see Chakrapani, very clearly he says Shirogata Sneha as Mastishka. Mastishka Shirogata Sneha. So it says that Shirogata Sneha itself is Mastishka. So you know Sarvada Sarvabhavanam Samanyam Uttikaranam. So if you are giving Sneha property substance, then again the Sneha which is present inside the Mastishka or brain, it will be corrected. That is the logic behind Sneha procedure. So moving on to special measures what we are adopting here. As general what we are using, Medhya Rasayanas, Acharya Charaka mentions for Medhya Rasayanas, that is Manduka Parni, Eshti Madhu, Gudiji and Chankapushpi. These all will be used in Churna form, Swarasa form, Kalka form, any form it will be utilized. So normally used Kritas like Kalyana Krita, Brahmi Krita, Panchagavya Krita, Samvardhana Krita, again Kashyapa specially indicated in this type of children. Some Sarpatyashu Gachati, very clearly Acharya says, some Sarpatyashu Gachati, because the child is having, a creeping child will attain the milestone very, very easily. So these are indicated, specially indicated for development disorders. And Panchakarmas will be adopting. Let us see that what are the formulated common we are using. So Thaila Yogas, I'm not going one by one. These are the common Thaila Yogas what we are practicing. Thaila Yogas and Krita Yogas, the number of Krita Yogas will be more. You can see that more number of Krita Yogas, because I told Shiro Antargata Sneha, it is Kapala Antargata Sneha is, it should be corrected. So Sneha is best thing, Krita is the best thing. Okay, so Samvartana Krita, Ashwagandha Krita, Dhanvantram Krita, Kalyana Krita, Chagaladi, Brigat Chagaladi and Simple Chagaladi, Brahmi Krita, Shatavari Krita, Indikantam Krita, Amrita Prasharasayana. These are the different yogas what we are practicing. Again, Kashaya yogas like Dhanvantram Kashaya, Gandharvastadi, again depend upon the avastha of the child, depend upon the need of the child, because Gandharvastadi normally we use whenever there is Apana Dushti. If the child is having Malasanga, we may practice Gandharvastadi Kashaya. Okay, if it is normally in cerebral palsy children, 70% of the cases you can find out the causes, and 30%, as Ayurveda says, it may be Yadricha, it may be Deva, okay, it may be Purva Janma Krita. Almost 30% we cannot find out the causes. So Dhanvantram Thaila, Dhanvantram Kashaya will be utilized whenever there is a history of marma abhikata. Okay, so same way the different tailas and kashayas will be used. Ashtavargam, again I told that whenever there is a avarana, because Ashtavargam is also called Sajnadi Kashaya, so it contains leshuna. Okay, leshuna. So it is very good in again sarvangavada when it is affected because of avarana. Okay, so these are the different preparations what we are using. Again, Kalyanagam Kashaya, whenever there is a mental retardation, the ideal choice will be Kalyanagam Kashayam. Okay, and Arishta yogas like Belarishtam, Ashwagandha Arishtam, Dashamula Arishtam, Saraswata Arishtam, Abhaya Arishtam. Again, Mahisha Dravagam, that is a special preparation. It contains nothing but Vella and Mahisha Mamsa, Mahisha Majja. Okay, so Mahisha Dravaga is also a Brahmana Chikitsa, so it will be given to the child. So next is Buddhika yogas like Kumara Paranarasa. So different Saraswata Matra. If again speech is affected, sometimes we may adopt Saraswata Matra, Ekanga Virasa, then Bhratwada Chintamani, Vata Gajankusha. Different preparations will be used. Again, you should think that whenever you are giving in a small children, it should be given with Gokshura or Punarnava Churna. These tablets can be mixed, powdered, and it should be mixed with Gokshura or Punarnava Churna, because a Mutrala drug, when it is given, it may check the complications. And Churna like Rajanyadi Churna, again, Rajanyadi Churna is used in almost all the Bala Vikaras, but Rajanyadi is an excellent drug. It does Grahani Deepanam. So it changes, it improves the Agni in all area. It may be the Adhuakni or Jatrakni. So commonly we use Rajanyadi Churna. Kalyana Avaleha Churna, again, if the child is having dripping of saliva or if the child is having speech, some abnormality, we may be using Kalyanaka Avaleha. Vacha Churna and Pela Yoga, these all will be practiced when there is some speech abnormality. Vacha Churna is ideal, and Vacha Rudrakshadi Churna, one Churna combination is there, it is also excellent. Then Rasnadi Churna, mainly we after Snana and all, we will ask the patient to apply over the Murti Pradesha. Kachuradi Churna and Rasnadi Churna mainly used in Talam it is used. And Kachuradi along with Amlaki Churna will be used for again Tala Podichin, a procedure, a Murtini Thaila itself. Let us see that I told that there will be some specific features in the cerebral palsy. Suppose if the sparsity is the hypotonicity is the main feature if you are getting in the cerebral palsy. Acharya Vakvada very clearly says Tailam Sankuchite, if there is sparsity, Abhyango Masha Saindava Sadhita Taila should be used. So ready-made Taila is there, Maha Masha Taila, it can be used. So normally, if you see, when a child is having upper motor neuron lesion, in long run, there will be muscle bulk will be reduced. Same way sparsity will develop, same way muscle bulk will be reduced. In that condition, the Maha Masha Taila is an excellent Taila preparation. If the sparsity is very, very prominent, then Prasaranyadi Taila is. If diplegic cerebral palsy, Adharakaya is involved, Sahajaradi Taila will be taken. Again, Marma Abhikata is established, well established. Then you can think about Dhanvantran Tailam. And Svedana with Shashtika Pinta Sveta or Mamsa Pinta Sveta, or another one variety of Svedana we are doing, that is Nyavara Tepa. This Shashtika rice, again, it will be cooked in Dashamula Kshira and it will be applied over the body, and a massage, a gentle massage will be done. So same, it is called Nyavara Tepa. In Kerala, Vikalpa Chikitsa. Again, a simple Chikitsa in Kerala, what we are using. And bastis like Sneha bastis, it may be a Matra basti or it may be a Anvasana basti. Yabana bastis like Mustadi Yabana basti, or different Yabana bastis will be used in Yoga basti schedule. Yoga basti schedule means 3 Kashaya basti and 5 Anvasana basti will be given. Niruha basti, again, Niruha basti is like Dashamula or Erandamula Niruha basti. Different Manjishradi Niruha basti will be utilized. Then Shamana yogas like Bhratwada Chintamani, then Sahajaradi Kashayam, Mahamasha Tailam, different things will be Prasaranyadi Kashayam. These all will be utilized along with physiotherapy. So if the child present with mental retardation. I told that associated complaints, cerebral palsy, there will be mental retardation. Okay, nowadays mental retardation terminology is not used. Intellectual disability only will be utilizing, because you should not say that mentally retarded. It is intellectually deficient child. The child will be having intelligence, some intellect is deficient. Okay, so the treatment is Sneha Basti, again Brahmi, Kalyanakam, Gritas will be used, or Samvardhana Grita. I told Samsarpatyashu Gachati, Muka, Jeta, this whole condition, it is very specially indicated. And Shamana yogas like Medhya Rasayana, before I told that, Saraswata Krita, Ashwagandha Arishta, Kalyana Kavaleha Churna, Shanka Pushpi Churna. Again, Shanka Pushpi Churna is very good when it is mixed with milk and if you give it. Okay, these are mainly given in mental retardation. So Medhya Rasayana, before I told that Medhya Rasayana, Manduka Parni, or Brahmi, or Ishtimadu, different sort of things in different forms it will be used. It may be a simple Kshirapaka, Kshiram Ashtagunam Dravya, 8 parts of milk will be added and it will be reduced and it will be given to the child. Okay, same procedure will be adopted with Medhya drugs. So next is cerebral palsy with speech problem. Whenever there is a speech problem, again, sorry, Shiro Abhyanga and Shiro Dara, Murtini Tailas will be practiced. Again, Shiro Abhyanga and Shiro Dara. Tala Podichil, again, Tala Podichil will be done with Amalaki Churnam or Kachuradi Churnam, or sometimes it will be added with Himasagar Taila, Kshirabala Taila, or Tungadrumadi Taila. Different tailas will be used for making the powder into paste, and it will be applied, and almost 2 hours it will be kept there. Okay, so after removing, Rasnadi will be applied. So it is very effective, and there will be few changes in the speech of the child also with one course of treatment. Anyway, I will say about the we got a good example in it. And next, speech therapy. Again, it is very needed. Don't think that with our treatment only it will be corrected. You need multidisciplinary approach. Don't keep any ego. You send the patient for, if the patient is having epilepsy, let them treat with anti-epileptic drug. If with your medicine, if it is not controlled, okay, along with that you start your medicine, 100% the result will be better. Okay, multidisciplinary approach is not needed always whenever you are treating cerebral palsy. And Shamana yogas like Kalyana Krita, Kalyanakam Churna, Vacha Churna, Saraswata Krita, Saraswata Arishta, these all will be used when there is speech defect. So next, cerebral palsy with hypotonia. Hypotonia, I told that ataxic variety and hypotonic variety of cerebral palsy. So mainly we think it as Avarna Vada. So Avarna line of treatment will be given. So Acharya says, Pitwa Avargam Akretu Vate Vatahari Kriya. Pitwa Avaragam Akretu, which is causing the obstruction, the Sangha to the Strothers, it should be treated first. Then one has to think about Vatahara Chikitsa. Vatahara Chikitsa. So the like Ashwagandha Grita, Chagaladi Grita. So remember, once the Avarana is treated, then only think about Brahmana Chikitsa. That is Ashwagandha Grita, Chagaladi Grita, Shatpala Grita, Mahamasha Taila. These all will be given as Matra Basti. And mild physiotherapy will be given. Hypotonia, again physiotherapy is needed. Shamana yogas like Ashtavargam Kashaya, before I told that it contained Leshuna, so it is very good in Avarnavada, or Rasona Adi Kashaya, Ashtavargam Kashaya, Ashwagandha Arishta, these all are commonly used prescriptions. So moving on to CP with seizures, again, we get almost 40% of the cerebral palsy which will be associated with seizures. Again, it will be difficult to manage also. Okay. So, Basti Karma, again, Kalyanakam Panchagavyam, Kalyana Grita, Panchagavya Grita, Brahmi Grita, again, Manjishtadi Yoga Basti, and Deshamule Yoga Basti. These all are commonly used Basti yogas in if a child present with apasmara, with cerebral palsy. Next, Nasya will be done in that children, like Shirabala 101 Avarti, 101 avarti or Dhanvantram 101 avarti, it will be in Prati Marsha. It will be given Prati Marsha. It will be given in a elder child. It will be given as Marshanasya itself. And Virajana, if a elder child, it will be Virajana will be adopted, and otherwise only with Vairajanika Basti we will be treating. Before Acharya Ashtanga's reference I told, Basti Sadhyo Viragena, Basti can be adopted for same purpose of Virajana. So Murthini Tailas like Tungadrumadi Taila, it may be in the form of Pichu, or it may be in the form of Shirodhara, or it may be like Talapotichil. This media will be used, Bella Taila, Shira Bella Taila. And Shamana yogas like different Krita yogas, Tantu Pashana, different Krita yogas I told, whatever Basti you are giving, same Krita can be given as Shamananga yoga. Okay, night time, that is sufficient. And always remember, whenever you are giving Basti, Agni should be kept in mind. You should add Ashtajurnam or any Deepana Pachana Drivya along with Krita. When we used to give 5 ml of Krita added with almost 2 grams of Ashtajurna. Next is Tantu Pashana, Kumara Bharana, Kumara Kalyana Rasa, Pompanchadi Gulika. Again, a traditional practice, Pompanchadi Gulika. It is very effective in Apasmara. Then Smriti Sagar Rasa and Vettu Maran. Vettu Maran in Malayalam, Vettu means nothing but convulsion. It removes Maran means it removes convulsions. So Vettu Maran Gulika. Mainly, if the child is having febrile convulsion, this Vettu Maran is very effective. So what we practice Ananda Bhairavi Rasa, almost similar combination you get in Vettu Maran Gulika. So cerebral palsy with eye problems. Again, I told strabismus or nystagmus presentation. Maximum children will be having strabismus, that is squint eye. It may be because of a defective control of the muscles, or it may be involvement of 4th cranial nerve or 7th abducent or trochlear nerve. Because of that, there will be strabismus. So what we used to do, eye massage with Shira Bella. This OP based, we will prescribe Shira Bella, and we will ask the mother to massage over the lids with Shira Bella Taila. And Lepa, again Anna Lepa, simple Anna Lepa, what Shastika SSPS, what we are doing, same way Anna will be cooked and Lepa will be prepared. This Anna will be applied over the lid area or orbital area. Okay, Anna Lepa with Mamsa. So these procedures look very simple, but it is effective. And next is Ashchodana with Jivantyadi, Patoladi Krita. Again Tarpana, again with Jivantyadi, Patoladi or Tripaladi Krita. Eye exercise. Eye exercise, again, practically speaking, in smaller children it is difficult. So bouncing ball, simple ball game, we will say them to play, or different color objects will be given and it will be moved in front of the eye. So the child will turn and you will make immobile the head, and the child will try to move its eye only. That type of exercise will be done. And Shamana yogas like Akshabijadi Kashaya, Jivantyadi Krita, Patoladi Krita, Tripala Krita, these all are commonly practiced. So this is a case, you can see that a child brought to the OP with development disorder. So when we noticed the child was having some involuntary movements, and main affected area was lower limb. I will show the video. So the child was having involuntary movements, jerky movements, along with mainly the lower limbs are affected. So we considered it as a mixed variety of chorioathetoic cerebral palsy and diplegic cerebral palsy, because the history was favoring. The MRI revealed that the child was having periventricular leukomalacia. I was saying that in preterm babies it is common, and the child is also a preterm baby. 8th month the child delivered, and post-term there was not kernicterus, there was increased bilirubin. So they have not diagnosed as kernicterus, but it has stained the ganglions. It may be because of that only the child is having involuntary movement. So MRI, we got periventricular leukomalacia as the presentation, and there is a lack of movement or lack of development in the lower limb with involuntary movements. So the child was almost 8 to 9 months under our treatment. So when the child reported to us, the child was having only sitting milestone, So the child was not able to stand with support also. You can see that after one course of treatment, almost 9 months, I told the child is under our treatment. But due to pandemic, we were not able to admit the patient. But in January, when the first wave has decreased, the child came and admitted. He came from Pondicherry, from Tamil Nadu, Pondicherry. So he got admitted almost 20 plus days, almost 3 to 4 weeks, I think 3 weeks. So you can see the video. See, now the child is able to climb. When the child report to us, the child was having only sitting milestone. So the child is able to see with difficulty also he is climbing the chair. And you can see there is some sort of involuntary movement. The child is not stable, the child is moving. So I told it comes under chorioathetoic variety of cerebral palsy along with a diplegic variety. So I considered it as a mixed variety of cerebral palsy. So after January admission, the patient went and I told that you have to come and report to me on after 3 months. So almost 2 months after that, the patient sent me WhatsApp message due to pandemic. He is not able to get admitted. He is continuing all the medications, what I told. And added feature I told, the child was having convulsions too. The child was getting convulsions. So I prescribed Kombanjadi Gulika. Before I told that Kombanjadi Gulika is very excellent in convulsions. Again, I prescribed, but the tablet was not available in his area. But he searched in some internet and he got the medicine. Anyway, you can see that after first 1 month of treatment, you can almost 3 weeks of treatment, you can see the improvement. He has sent me the list, WhatsApp list. Listening and response to what we speak has improved. That is improvement. Squint eye reduced. The squint eye has reduced. Again, climbing up and down on sofa, chair and cot. You can see here the climbing up. Before the child was having only sitting milestone. He was not able to stand also. There is much improvement in 9 months. And no seizures for past 9 months. That is also one achievement of Ayurveda. And babbling and trying to speak. The child is having with me at the time almost 3-year-old, almost near to 3 year, 2 year plus child. So the child was not having even proper language development. Normally 1-year-old child will be having 10 words with meaning development. So the child was having only 2 words like amma, some 2 words child used to speak. So there is improvement in speak. So all area our Ayurvedic treatment has shown improvement. Once more, I am showing the video. See, there is improvement in the muscle strength, but 100% muscle strength is not attained. You can see some sort of improvement in the muscle strength. So the treatment what we have done in our admission, that is first Udvartana. I told that we are whenever we admit the patient in our clinics, in our medical college, we follow only classical line of treatment. But when I practice in my hospital, I practice randomly any sort of treatment. But classical, because students are trained under us, so we used to do classical treatment only. So Kevalam Nirupastambam, the Nirupastamba avastha, so Rushana was done. So Rushana in the form of Udvartana was done. After Udvartana Sarvangapyanga, and Talam was Murthini Taila in the form of Talam was given first. After that, Basti was practiced. That was Matra Basti only with Brahmikritam, and Shiro Dhara. Dhara was practiced for 7 days. So total 20 plus days we admitted, almost 3 weeks we admitted the child. So there was marked improvement. So it is another one child. The child is now admitted in the ward. Right now the child is admitted in the ward. It is also one variety of spastic cerebral palsy. So the lower part of the body is involved. So it can be clearly diagnosed as spastic variety of diplegic cerebral palsy. Diplegia is the presentation, and there is spasticity in the lower extremities. So the mother is holding. Okay, you can see the video. After that, I will explain the case. The child is from Talasheri. So the child is 4 years old, 4-year-old child. She has not attained my walking or standing milestone. The child is able to sit without support. Without support, the child is able to sit. So think they are having an elder child. He is also cerebral palsy because both the child is preterm delivered. The child is delivered almost 6th month. The elder brother, he is 16 years old. He is also a CP child. They were not aware about Ayurveda. They have done only modern treatment. The child has not attained any sort of development. The child is bedridden. So anyway, anyhow, they have reached to our center in the early age. I won't say early age, almost 4 years, 4-year female child brought to the OP with the complaints of, in brief history, I can say you, a 4-year female child brought to the OP with the complaints of standing and walking milestone delay. So on examination, we come to know it was a preterm delivery and consanguineous marriage. Always remember Sagotra Vivaha, Ayurveda also says there is chances of mutations. Okay, so congenital abnormalities, some syndromes should be ruled out always. So what will happen whenever a child is having neurological presentation, we in Ayurveda, we directly name them as cerebral palsy. It's a bad trend. So remember, cerebral palsy, maximum disability, that is 15 to 20% will be cerebral palsy, but there are metabolic causes like ammonia increased condition. There are some other deficiencies like calcium deficiency or vitamin D deficiency. Also, the child will not walk in the proper age group. So always remember, I was having a case, the case report to me in the age of 1.5 years. So somewhere outside, a popular Vaidya was treating this case. So he was giving all the Shashtika Pinda Sweta, all the Vatahara Chikitsa, still there is no result. So the child report to us. After examining, we come to know a simple calcium deficiency which was causing difficulty in walking. Because classical, whatever we say, the enlargement of epiphyseal end, the anterior frontal was wide open. These all features suggesting calcium deficiency. So we given supplementation. From that time, we started, within 3 months, child started walking. So always remember, don't name each and every presentation which is having neurological presentation as or a walking difficulty as cerebral palsy. Remember, there are few more conditions which may present with walking difficulties. So anyway, coming back to the case, the patient was a female patient, 4 years old child, brought to the OP with a complaint of standing and walking milestone delay. And also it's a preterm delivery. Remember that it was 6th month delivery, non-consanguineous, and the child is delivered normally. Why delivered means there was early rupture of the membrane, fluid leak was there, then suddenly they went for delivery, and the birth weight was 1.4 kg. Again, very, very important, whenever you are dealing with development disorder, you think that you should ask a question whether the child cried immediately. It says about the active respiration of the child. Very, very important. You think that you ask to the mother soon after birth whether the child cried. It says that there is no hypoxia or anoxia. So you can rule out how hypoxic ischemic encephalopathy or injury to the brain. Okay, hypoxic injury to the brain. So here the baby cried immediately, but suddenly developed respiratory distress. You know, in a preterm baby, what will happen? The baby is 6th month, less than 28 weeks. So remember, there is chances of surfactant deficiency. Surfactant is a substance which maintains the patency of the alveoli. You know, alveolar structure, grape-like structure. To maintain the patency, there should be surfactant. So surfactant deficiency, which may cause again patency will be hampered, the patency will not be maintained, then suddenly collapse of the alveoli, there will be hypoxia, which in turn, it is also called as Hallin membrane disease or IRDS, idiopathic respiratory distress syndrome. The outcome will be hypoxia, or anoxia, which is causing injury to the growing brain. So here it happened, they directly shifted the child to respiratory distress was there. They shifted the child to NICU, and the mechanical ventilation and surfactant therapy was given. So there was a history of CHD, atrioseptal defect. A small CHD was there, congenital heart disease CHD was there. That was 4 to 6 millimeter hole between the septum, a congenital heart disease. It closed by itself, almost by 3 years, it closed by itself. So at present, the child was having these whole features, difficulty in walking and difficulty to attain standing milestone and walking milestone. So we look into the natal history. So there was premature rupture of the membrane, which was the cause for a preterm delivery. And at the time of delivery, soon after delivery, the Apgar scoring was 5 out of 10. It clearly indicates there is hypoxia, because normal child will be above 7. 7 indicates, or 4 to 7 indicates there is hypoxia. Below 4, it is a severe hypoxia or anoxia. So normally 7 to 10. So the child scoring was 5 out of 10. Total score is 10. The child was having only 5. So clearly there was hypoxia. And the MRI report, I told that in a preterm delivery, if you send the child for MRI report, there will be bilateral periventricular white matter will be involved, and the term is called periventricular leukomalacia was the presentation. Along with that, there was thinning of corpus callosum, So you can see that the video, the child is not able to walk, and you can see that a typical feature you are seeing in the ankle region, it is called toe walking. Toe walking means the toe will be utilized for walking. It is because of the spasm in the Achilles tendon or tendocalcaneal ligament, okay? And the child is having spasm in the adductor group of the thigh muscle, okay? Adductor group of the thigh muscle, what will happen? The child will be having a scissoring gait. It is called scissoring gait. If you hold the baby up little more high, the legs will be crisscrossed like a scissor. It is called scissoring gait. That is also a classical feature of diplegic cerebral palsy. Remember, toe walking and scissoring gait will be the classical feature in diplegic cerebral palsy. So without any second thought, we diagnose this condition as diplegic variety of spastic cerebral palsy. So let us see the treatment what we adopted. So soon after that, we have started the treatment. So I told Kevala Nirbastambhavastha, Rukshana Chikrisa, we started with Utvartana. You can see the procedure, what we are performing. The child is enjoying the treatment. So Vilomagati, again, we are continuing, we are doing Utvartana in the all the body, full body for making Kevala Vakavastha or Kevala Nirbastambhavastha. Okay, so excess treatment should be done in the lower extremities. I told massages. So they are concentrating more over the lower extremities. Okay, this is called Utvartana. So it is for the purpose of Rukshana only we have done. So we can go for Dhanyamladhara, we can go for Podikiri. Podikiri means Churna Pindas Sweta. Or you can go for any sort of Rukshana karma, or if the patient is not able to get admitted, you give Kashaya Yoga. Kashaya Yoga itself will act like Rukshana. So you admit the patient, before admitting the patient, give Kashaya Yoga. Some patients we used to advise, you take Kashaya for a period of 30 days or period of 45 days and come and get admitted in our hospital. So normally 45 days, if they take Kashaya, 100% the Rukshana will attain, the Amatva will go, and you can directly start your Snehana Kriya. Okay, so this the video, it is Abhyanga, Sarvanga Abhyanga, what we are doing. So Sarvanga Abhyanga, the procedure. After, so now Sarvanga Abhyanga is going on. Next, we are going to plan Upanaha. Upanaha means over the lower limb, we will be using Kola Kulatadi Churna along with Murivana or some other thylas, which will cause Prasaranya, the thyla, Murivana, or some other thylas like Kaya Tirmeni thyla, which all are explained in different context of Madhikata will be utilized, or to reduce the spasticity will be doing Upanaha, bandaging with Kola Kulatadi Churna. We will night aways, we will bandage the child's lower extremities. We will keep the limb into a neutral position and we will bandage it with a splint also. We will bandage it. After that, this bandage will remain overnight. And next morning, we will release the bandage. Okay, if the child is not able to sleep, almost by 10 o'clock, we will release. If the child is not having much complications, we may continue this bandage overnight, and next day morning, we will advise to remove the bandage, and Apinga will be continued. Okay, Apinga will be done. After that, we are planning to Murthini Thaila, mostly in the form of Shirodhara may be planned. Okay, so in this child, I am going to plan Shirodhara because periventricular upper motor neuron lesion, Murthini Thaila is must, very must. So this is the. So here I am ending the experiences what I want to share. So take home message, a simple take home message I am saying. I have spoke almost 1 hour about cerebral palsy and its management. So in brief, we can understand that physiotherapy seems to be only alternative. So if you go to modern science, a normal pediatrician, once they come to know the child is having some neurological abnormality, directly they will say, you go for physiotherapy. Again, that is the part advice what they are giving. If they are sending the child to a Ayurvedic doctor, they can manage this condition better way, and you can add physiotherapy. So I am saying that only one alternative in modern therapy, that is physiotherapy. Otherwise, after contractures, they may do rhizotomy or tenotomy or whatever surgery they will do. So till that, they won't manage this condition. So before I was saying that child's, that daughter's elder brother, he is 16 years, he is having spasticity now. If they take the child now to a pediatric surgeon, they will do the surgery to reduce the spasticity. Till that, they will waste the time, because early intervention is very important. In this sort of children, early intervention is very important. So Panchakarma compounded with Medhya Rasayana and training in day-to-day life becomes comprehensive. Always remember, Panchakarma having its own role along with Medhya Rasayana, and training is also very, very important. Training, the best trainer is mother. So don't think that if you take the child to a highly advanced training center, your child will change. No, you have to train each and every minute when you are free. So always we advise mother, you find time. There will be elder children, younger children, but still you find time for the cerebral palsy child. Okay, and early detection, that is very important. So I told that early mark is early detection, early intervention, and planned multidisciplinary management may show better results. So I am saying that early intervention is very, very important. So almost in the first 6 months itself, you can identify that the child is having some abnormality. There is some neurological development or the growth and development abnormality. Suddenly you find out whether it is very severe, then directly you start with Ayurvedic interventions. First you diagnose the condition, whether it is a cerebral palsy. Okay, so I told that many metabolic cases also you will treat, and later phase only you will come to know it was a simple ammonia which was causing injury to the, or damage to the, or irritation to the brain. Okay, and there was development delay. So you first diagnose the condition and then you go for early intervention. Intervention should start from 6th month itself. Ayurveda also says in anterior frontal LA you have to go for Pichu Dharana. Pichu Dharana, Ayurveda says, again it is Vatahara. So Pichu Dharana can be started in the early period along that is early intervention. After 1 year, you can almost by 10 months, we used to start with Matra Basti. Matra Basti, after 10 months, we are practicing. So don't think that Basti cannot be practiced below 1 year, but if you are giving Basti, you should give yourself, because a massager he will not do it properly. Otherwise, a trained and experienced massager can be given Basti to a smaller children, because there may be sudden vagal reflex and sudden complications may happen. Always remember that whenever you are planning a Basti, because Kashipa says that Atastano Denda, again once the Denda develops, Tato Ashtamo Mase, again clearly he says, Atastano, again 10th month Acharya said that one can go for Annaprashna. So in mean you can say that 10th month you can start Matra Basti. Again, Matra is nothing but in one yama, what it digests, that will be the Matra. So normally we practice 20 to 30 ml of Thaila. Again, it will be added with Saindava and it will be given to the child. Okay, anorectal with a catheter. Okay, and planned multidisciplinary practice. Again, multidisciplinary. Always remember, don't keep our ego. Okay, so you send the child to a speech therapist, you send the child to a occupational therapist, you send the child to any sort of therapy which will give ultimate result to the child, and management may show better improvement. So I have shown that what are the improvements we are getting. So anyway, here ends the presentation. So the presentation, who all are hearing, if they are having any queries, they can ask to me right now. Thank you.
So many thanks to Dr. Sayan S. Nair, sir. And you have presented very beautifully. And now actually the clinical Ayurved Sambhasa is also now running on. ये अब हमारा सेशन जो है ये क्लिनिकल आयुर्वेद संभाषा में बदल जाता है. आज 2 लेक्चर्स हुए हैं. यहाँ प्रोफेसर उडुपा भी यहाँ पे हैं और डॉक्टर सायन एस नायर जी भी हैं और वैद्य अरविंद पाठक जी भी आ गए हैं. चलिए, तो अब आपके जो भी प्रश्न हो, अभी चूंकि संभाषा, सर वी आर नाउ इन क्लिनिकल डिस्कशन सेशन and you both are present, and here are the eminent Vaidyas from all over this India. So now the session is moderated by Vaidya Arvind Pathak. So I hope that first of all I am thankful to you for your very beautiful presentation in this very important subject, that is cerebral palsy. It's my humble request that I again call to all of you for giving your lectures in this platform. As Ayush Darpan is a brand which has thousands of lectures in the libraries, and it is totally free, and after some time the lecture will be premiered at the YouTube also. So now I think that some participants have already raised their hand. So I think that now Vaidya Arvind Pathak will take the responsibility of conducting this session, and I'm just giving him the responsibility. As I'm informing that there are 2 eminent professors. One is Professor Udupa, who is a professor in HOD from Basic Principle Department at Vaidya Arvind Pathak. This is your old department also. So he's a professor. Actually, he has offed his camera, and I hope that he is also now in session. And Dr. Sayan S. Nair is a Ayurvedic pediatrician and from the Mahe Government College, Puducherry. So now, Vaidya Arvind Pathak, now responsibility is given to you. Now you are the moderator of this session, and now you can start the clinical discussions. Thank you.
Thank you. Thank you. I am Dr. Arvind Pathak from Pune, Maharashtra. Dr. Dipti ji, you can ask question. Dr. Dipti ji, please unmute yourself. Dr. Dipti ji, 1 minute. I am doing this. 1 minute, please wait. Ji, Dr. Dipti ji, you can now ask the question. Dr. Dipti ji.
Yes. Okay, sir. Okay, sir. I want to say that in spastic cerebral palsy, there is toe walking, as sir said. So in the toe walking, there is a stiffness in the calf muscles and the tendon. So my question is that which doshas, because of which doshas it happens? It is Kshayajanya Vat Prakop or Avrodjanya Vat Prakop. And one more question, that in local therapies, Pindaswed works well in such cases. And in Shamana Dravyas, which drugs works well to reduce this spasticity, so that walk will improve? Toe walking के अलावा वो हिल तक वो टच हो जाए जमीन पे और अच्छा वॉक बने, इसके लिए शमन द्रव्याज में हम कैसे सेलेक्ट करें?
I think that Sir is muted. Sir, please unmute yourself. I think that.
Nair
सर
sir,
उनको unmute कर दीजिए.
Sorry. Okay. Actually, the question is when there is sparsity in the Achilles tendon, how we are going to manage. So in our clinical practice, what I just now I told, Upanaha bandaging will be done, because instead of more time it will remain in that area. So in that area, if you do bandaging, manipulation first should be done, because toe walking, normally the foot root will be there. So you may make the limb into normal position. If splint is needed, you may keep a splint also posteriorly and below. After that, you will bandage it. You will apply the churna. The churna is made into leba, like kolagulata churna will be added with any thaila, and it will be smeared. It will be applied over the area, and with maximum comfortable position, you will tie it. So overnight you will keep it. It is very effective. We have noticed that the spasticity will reduce. Again, remember, if there is clonus formation, clonus grade 5, then again it will be difficult to manage. You can try it, but in that cases, normally we send the patient for a tenotomy or a Z-plasty. It is called Z-plasty. The tendon will be cut and it will be again joined. So the tension will be released. Because of that, the child will be able to keep the leg straight. If it is grade 4 or grade 5 only, we will think about this type of treatment. Otherwise, normally Upanaha we will do. If it is not that much severe, simple pirichil or abhyanga itself will be sufficient. Pirichil is nothing but kaya segam. Kaya segam, the thaila will be all over the body. It is still better than abhyanga, sarvanga abhyanga. This way we used to manage in Panchakarma unit. Again, matra bastis are very effective. Like matra basti, prasaranyadi thailam will be utilized for matra basti. It will be added with again saintava, 2 pinch to 5 grams. It will be added, depend upon how much matra we will be giving. Again, next Shamana yogas like prasaranyadi kashayam, sahajaradi kashayam. When it is adhara kaya, it is very clearly we think about sahajaradi kashayam. Sahajaradi again he says adhara kaya vikaras. It is very effective, and practically speaking also we have seen. And it should be added with any thaila media. Thaila like sahajaradi will be added with Shirabala thaila, or it will be added with sahajaradi thaila, 5 to 6 drops, and it will be given. That is a normal procedure what we are following.
Sir, Panchamrit Loha Gugul will work in such cases as it is with the Prasarani Taila, because it also helps to increase the blood flow in all the tissues and organs.
I don't have experience with Panchamrita, what you told Gugulu, because Kerala.
Panchamrit Gugul is mentioned in Mastish Rogadikar, Bhashaj Ratnavali.
Okay.
Very effective in autism and CP.
It is very effective, right? We don't have, actually, I don't have any experience. In Kerala, we use very less rasa preparations. First of all, very less, and like Brahatvada Chintamani or our what we say Ekanka Veera Rasam, like few preparations only we are using rasa preparations. Kumara Kalyana Rasa, Kumara Bharana Rasa, then likewise only few. Vettumaran is also a preparation like Ananda Bhairavi. It contains rasa. Again, likewise only few preparations. Mainly we depend on karsta aushadhis.
Ji. Thank you, sir. Dr. Manoj Agarwal, sir. Dr. Khushbu ji, please ask questions. Dr. Manoj Agarwal ji. Dr. Minal Gupta ji. कोई क्वेश्चन नहीं पूछ रहा. डॉक्टर अंजना सक्सेना मैम, डॉक्टर अंजना मैम, डॉक्टर अवनीता जी, डॉक्टर वैशाली जी, you can ask question. Please unmute yourself. डॉक्टर वैशाली जी.
Hello, good evening, sir. Can you do you use Nastya in these cases? In
Yeah, I
CP
have
cases?
mentioned. I have mentioned. No, so Acharya Vakpada very clearly says, Marsha, whenever you want to go for Nasya. So he says, Basti Sadhyo Viregena, Marshena Pratimarshana. When Marshanasya is again difficult to practice, there is chances the child may aspirate and it may lead to a lipid aspiration pneumonia. So whenever you are doing Nasya, better you go for Pratimarshanasya. So we used to practice Shirabala. We used to even Pradhamana Nasya also. Vacha Churna will be practiced. Dhamana Nasya will be practiced. So in depend upon cases, we used to practice this all. In my presentation also, I told that use of Nasya.
Okay, thank you, sir.
Dr. Seema ji, you can ask question. Dr. Seema Tripathi ma'am, Dr. Rakesh Prajapati ji. किसी को क्वेश्चन नहीं पूछना है क्या सर से? डॉक्टर भारती देशपांडे मैम।
सर नमस्ते, डॉक्टर मीनल बोल रही हूँ आगरा से।
जी पूछिए, अपने ही सर हैं, क्वेश्चन पूछिए।
हाँ सर, सर एक सीपी के पेशेंट के लिए पूछना सर, जो हम इनमें
सर नायर सर, कैन यू अंडरस्टैंड हिंदी?
I will speak in English, no problem.
हिंदी में
Sir, we can we use Sashti Pind Sweda with that Balar Telam in this patient?
You mean that first Abhyanga with Bella Taila, after that Shashtika Shalipinda Sweda, right? You can do it. You can do it. Normally, we used to do some total procedures. Some 20 minutes we used to do Abhyanga. Mainly, we use Dhanvantaram Taila. Bella Taila is not commonly used. Dhanvantaram Taila will be used, or Shashtika Tailam. Another one Taila is there. Shashtika Tailam will be used, or Prasaranyadi Tailam will be used. First, Abhyanga will be done. Depend upon, again, whenever there is more contractions, more hypotonicities, my ideal choice will be Prasaranyadi Tailam. Okay, so once Abhyanga, so 20 minutes Abhyanga will be done, followed by some 30 minutes Shashtika Shali Sweta will be given. Some if the child is very small, we may prefer Nyavaratep. Nyavaratep is nothing but this Shashtika Shali will be cooked in Dashamula. What we do in Shashtika Shali bolus preparation, same way it will be cooked. It will be cooked for still more time, and this paste will be applied all over the body. The motto is nothing but Svedana. So this application itself will give Svedana, and gentle massage will be doing all over the body. So it is called Nyavaratep. It is also one variety of Svedana which is explained.
That is called Annalepana. It is called
Annalepana. Annalepana. Actually, it is made into Hindi terminology. It is called Nyavaratep. Nyavaratep. It is converted into Annalepana now.
Okay, sir. Thank you, sir. One thing more. How long we can continue this Navara, and then after Pitchil, if we will continue Navara, then Pitchil, how much it will take? It will take 1 month, or can we continue it more than 1 month in one stretch, or we have to take
one stretch never we practice 1 month, because Nyavara will be maximum for 7 to 14 days. If there is, I told that whenever there is involvement of upper motor neuron, I told that 2 tracts, pyramidal tract or extra pyramidal tract. Whenever pyramidal tract is involved, there will be spasticity, hypertonicity. So there will be spasticity or rigidity. The spasticity will be the presentation here. So spasticity, for that we used to go for if the spasticity is more, and if the bulk of the muscle is reduced, then we may prefer Annalepa or Shashtika Shalipinda Sweda for 2 weeks. Maximum period will be 14 days. So normally in schedule 7 days only we used to do SSPS, not a period of 1 month.
Okay, sir, if muscle density is low, then we should use Udvartana, as you said. First Udvartana and then Abhyanga. So if muscle wasting is there, then we should use Udvartana or not?
See, muscle wasting, again, you think that whether first muscle wasting is there, whether it is a pseudo hypertrophy or because of the complication of upper motor neuron lesion, you have to differentiate. If it is a muscle dystrophy, then never we used to practice Udvartana, because there are different varieties of muscle dystrophies like DMD, Duchenne variety of muscular dystrophy, Becker's variety of muscular dystrophy. So in DMD cases, we never used to go for Udvartana, Tishna or Ruksha Svetas. Ruksha Svetas will not be, the very mild Svetas will be given. Okay. So if it is clearly upper motor neuron lesion and if their bulk is decreased, if the child is having Amavastha, then think about Udvartana, no issue. You can practice Udvartana. Udvartana will be for 3 or 5 days. Okay. 3 to 5 days it will be practiced, followed by once the Vata will become normal, then you will think about Snehana Kriya.
Okay, then if Amavastha is there in CP patient, then we should use Udvartana. If Amavastha is gone, then we will continue only Abhanga.
After that, Abhyanga only. See, if you feel, before I told that, suppose if you are not able to admit the patient, at that time you start with some Rukshana Kashaya. Rukshana Kashaya, if you give for a period of 30 days, 100% when the patient will come, he will be ready for Sneha procedure. So you can directly start with Sneha procedure.
Sir, Dhanvantar Kashaya also use in Amavastha condition, na?
Dhanvantara Kashaya can be used, but the Dhanvantara, if Sheta is there, mainly Sheta, we indicate Dhanvantara. Marma Abhigata, if it is clearly established, we can go for Dhanvantara Kashaya.
Okay. But Marma Agat is also found in such condition, in CP condition also, na, sir?
No, every time we cannot establish that. I told no, almost 70% of the, because if you see Ayurvedic concept also, Ayurveda very clearly says, Bija Atma Karma Ashya Kala Dosha, Madhus Tatahara Vikara Dosha, Urvanti Dosha, Vividani Dushta, Samstana Varna, Indriya Vaikratani. Very clearly he says. Okay. So Charaka very clearly says in Sharirasthana, when Bija Atma Karma is also given important. Very, very important. Purva Janma Katam Papam, Iha Jammani Vyadhi Rupena Pitayet. So, whatever we did do's and whatever Purva Janma we did Papa, this Janma, it may present with disease. So, almost in modern explanation also, they say 70% of the cerebral palsy, you can find out the cause. 30% of the cases, you cannot find out what is the cause. So, in that 30%, again, how we can establish Marma Abhigata? If there is clear Marma Abhigata, you can think about it. Marma Abhigata Janya Vata Vikara is the presentation, then think about Dhanvantaran Kashaya.
Okay. Sir, if we have to distinguish between DMD and CP, then we have to distinguish on depending upon the symptoms or clinical presentation, or
no, simple way you can differentiate. Cerebral palsy, there won't be any attainment of milestone. Sir, in DMD, normally the milestone will be attained. After that, there will this milestone will again go back. Okay, go back means the attained milestone will become abnormal. Or other way you can say that in DMD cases, the classical feature will be climbing upstairs difficulty. Normally, the mother will say that the child was normal till now. Normally, by the age of 2 years or 3 years, almost 2.5 to 3 years, the mother will come and report to you, and they will say that till now the child's development was normal. Now the child is not able to climb upstairs. It is a clear indicator of Duchenne muscular dystrophy, DMD. Because in the first decade itself, the child may be bedridden. Maximum life expectancy is 20 years. If you do any sort of treatment, it may be modern, it may be any sort of treatment, Ayurveda, so Siddha, Unani, maximum life is 20 years. Okay, and cardiopulmonary arrest will cause the death of the child, because you know it's a proximal weakness. The hip region, the muscles will be involved. There will be pseudo hypertrophy of the calf muscle will be there. There will be raised creatine phosphokinase. Don't think that it will be in hundreds. It will be in thousands. The raised creatine phosphokinase and a biopsy from the calf muscle confirms the diagnosis of DMD. Okay, so once if you get these all symptoms, a child brought to the OP with the complaints of walking difficulty or climbing difficulties, climbing upstairs, And a classical symptom will be there, that is called go-away sign. Go-away sign will be positive. Go-away sign means if you ask the child to sit down, Sukhasana position, if ask the child to sit down without any support, we say it is climbing steps without any support of any chair or some other or his own knee, he cannot come to standing position. That is called go-away sign positive. These all are the classical feature to differentiate DMD from cerebral palsy. And the investigations I told, few investigations I told, with that you can confirm the diagnosis of muscular dystrophy and you can exclude cerebral palsy in that condition.
Sir, you said ki creatine phosphokinase is increased, but in motor neuron disease also this is increased, and hypertonicity also we got in motor neuron disease. Then how we differentiate from motor neuron disease and CP? Sorry,
So
DMD.
I told no, the lower motor neuron lesion features will be present here. So in MND, you will be getting mixed feature. You should think that which area the pathology will be happening. It will be happening in the anterior horn cells. In the spinal cord, the anterior horn cells will be the pathology which is happening. So there the lower motor neuron and the upper motor neuron unites together. Okay, so you will get a mixed feature of lower motor and upper motor neuron lesion in MND. So here clearly you will, and I told the classical history, the child's development was said to be normal up to some level. After that, suddenly child is not able to walk upstairs. That is a classical feature. There will be pseudo hypertrophy. It is not hypertrophy. It's a pseudo hypertrophy of the calf muscle. Again, very classical presentation you will be getting. Pseudo hypertrophy of the calf muscle. A raised serum CPK. I'm saying that don't think that it will be in hundreds. It will be in 10,000 or 15,000. It will be raised. Okay. CPK will be raised in all the muscular pathologies. It is very clear. When intestines are involved also, CPK will raise. But here it will be in thousands, 10,000s it will be raised. And in once it become chronic, in the early stage you will be, CPK will be raised. Once it become chronic, the CPK level will go on decreasing. Okay? That will be the typical feature you will be getting.
But sir, why there is a pseudo hypertrophy of calf muscles in DMD?
That is a classical presentation. We cannot say why, because it is the feature we are getting. Mainly the dystrophin. There is an enzyme called dystrophin. Dystrophin deficiency is causing DMD.
Okay, thank you, sir.
Okay, thank you.
Dr. Rakesh Shukla ji. Dr. Rakesh Shukla ji, you can ask questions. Dr. Avnita ji. डॉक्टर हरिओम सर।
हेलो सर, मैं पूछूं?
हाँ पूछिए, अगर हिंदी में बोलना है तो हिंदी में पूछिए।
नहीं ठीक है, चलेगा। सर, you mentioned Udvartan, so which tunes you use for Udvartan, and do you mix with oil for Udvartan or plain only tunes?
No, we normally use Kola Kulattadi Churnam. And when I am saying Udvartana is powder only. It is Utsadana. You are saying about Utsadana. Utsadana we will add with Taila and we will apply over the body. We will do massage over the body. That is Utsadana. It is Utkarshana only. That is Udvartana. Utkarshana only we will be doing. I have shown the video also, I think.
And sir, for Tota Avrad Jan Vat Prakop, which drug of choice or which drug you mostly use for Marga Avrodjan Samprapti?
So, Avarna line of treatment I told no, the Leshuna containing Ashtavargam, Bella Sahajaradi Kashayam, Bella Sahajaradi Kashayam. It is explained under Sahasra Yoga. Okay, and Resonadi Kashayam, Resonadi Kashayam. Again, these all Kashaya when you are giving, you should think that it should not be Pitta Prakriti, Pitta vitiated condition. Again, keep in mind.
Okay. Okay. Thank you, sir.
Okay, thank you.
और किसी को प्रश्न पूछना है तो पूछिए।
Yes, sir. Good evening,
Dr. Rakesh Shukla ji.
Yes. Good evening, sir.
Good evening.
Actually, I want a question, sir. For Ayurvedic practitioner, any institution who gives the training for CP child with the Ayurvedic treatment? Any institution are there or you have, sir?
As if there is no such institution, I know. So almost all the medical colleges they are practicing, they are giving training for their students. Other than that, I am not aware about it because I am from Kerala. And the Mahi is also a small area of Pondicherry which lies inside Kerala, this region. So in Kerala, I can clearly say that no such trainings they are giving, no such short-term trainings or courses they are conducting. So only thing, if you are a student in the college, you will get 1 year exclusive training, 1 year in that 1 month exclusive training in Kaumarapur. Only that I know. Remaining, I don't know. If you want, I will inquire and I will inform you.
Dr. Kusum ji, you can ask question. Dr. Savita Landewar ma'am. Dr.
Sir,
Chan
just
Sharma
a minute,
ji.
sir. Sir,
Yes,
sir,
sir.
just a minute, sir. Because
Yes, sir.
my battery is down. So shall I connect the power to the
Yes, sir. Yes, sir.
laptop?
Yes,
Just
sir.
a minute.
Okay, sir.
Okay.
डॉक्टर रानू मंडल जी, आप लोग प्रश्न नहीं पूछ रहे हैं, ऐसा क्या है? प्रश्न पूछिए आप लोग। डॉक्टर मधु अरोरा जी,
वैद्य अरविंद जी, अगर प्रश्न नहीं है तो हम डॉक्टर साइन सर को कह सकते हैं कि अब आप सर, योर सेशन, आई थिंक ब्यूटीफुल सेशन एंड आई होप दैट दिस इज आल्सो लेट नाउ फॉर यू।
वो कनेक्ट करके आ रहे हैं सर।
यस,
वो कनेक्टर ज्वाइन करके आ
अच्छा।
रहे हैं। 2 मिनट रुक जाइए। डॉक्टर वैशाली मैम का प्रश्न है। डॉक्टर वैशाली जी, आप क्वेश्चन पूछ सकती हैं, सर हैं।
Hello sir, will you allow students to come to your clinic and learn something from you?
अभी सर आ रहे हैं।
2 मिनट रुक जाइए, आ रहे हैं सर। कंटिन्यू बोलते बोलते थोड़ा थक गए ना, थोड़ा पानी वानी पी लेने दीजिए। डॉक्टर दीप्ति जी, आपने बहुत अच्छे क्वेश्चंस पूछे सर से, बहुत अच्छा लगा।
थैंक यू सर।
फिर वोट ऑफ थैंक्स कौन बोल देगा? आप दीप्ति जी, आप बोल दीजिएगा। सर आ रहे हैं 2 मिनट में, तब तक
उन्हीं से वोट ऑफ थैंक्स बुलवा दीजिए।
दीप्ति जी बोलेंगे, लेकिन सर आ रहे हैं 2 मिनट में। उन्होंने कहा कि मैं आ रहा हूँ। किसी को और कोई क्वेश्चंस पूछना है सीपी से रिलेटेड, डीएमडी से रिलेटेड, तो पूछ सकते हैं। आप लोग हैंड रेज कर लीजिए। सर आ गए, नायर सर, वेलकम सर, वेलकम अगेन। डॉक्टर वैशाली जी, अपना क्वेश्चन पूछिए।
Hello sir, will you allow Ayurvedic doctors to come to your clinic and learn something from you?
Actually, if the college permits, you can come and you can join with me, no problem.
जी, और किसी को कोई क्वेश्चन पूछना है तो पूछिए।
सर, मुझे क्वेश्चन पूछना है। I don't know whether you talked about the DMD pathology from Ayurveda point of view, because I joined in between. So, if not, could you please explain? Thank you.
Actually, today's discussion is not DMD, cerebral palsy. Still, you have asked the question, so I can say. So we considered it as Mamsakshaya concept, and we used to do Brahmana Chikitsa. And if the child is very obese, so normally we go for Kharshana Chikitsa, Rukshana Chikitsa. So Rukshana Chikitsa, again, keep in mind that whenever you go for Svedana Karma and all, don't go for very Tishna Sveda. Tishna Sveda, again, it may cause complication in the child. So always maintain minimum Sveda and minimum procedures to the child. You know that normally DMD, when it is established, it is diagnosed, maximum life expectancy will be 2 decades. 2 decades means 20 years. So yes, unnecessary, you should not create problem for the child. Only thing you can give some supportive therapy to the child to live properly, to day-to-day activities. The child should not bedridden. Child should not be bedridden. to change that one to quality of life can be improved by our Ayurvedic medications. So we got a few cases, few typical cases, because it's a X-linked disorder. Mainly males will be the sufferers. X-linked disorder, you know, X-linked disorder. When X and Y comes, X mother will be the carrier. So X will reach to the baby. X and Y, the male will be the presenter. But we got a siblings, 2 sisters. So Mahi MLA has referred that case to me. So 2 sisters, they were having DMD, 2 females, they were having DMD. So it's a typical presentation we got.
Right.
So
Okay.
mainly I'm saying that only the quality of the lives can be changed or improved by our Ayurvedic treatment. Don't expect much, because whenever there is cardiopulmonary involvement, the intercostal muscles, I told that the weakness in the proximal region, when it will ascend upwards and descend downwards, the baby will be, or the child will be bedridden. And when it ascend upwards, so there will be involvement of cardiac muscles, diaphragm, which is helping, or accessory muscles which are helping in the respiration. When it is involved, there will be surely cardiopulmonary arrest, and cardiac muscle also will be involved. Cardiopulmonary arrest will lead to death. So maximum will be 20 years.
Okay. Thank you, sir.
Sir, I want to ask one more question.
Yes, yes. Arshia ma'am.
Yes, sir. Sir, I want to ask, you said in Avranjanya Vat Prakop, first we should do Avranjanya drugs. Can we give first, or can we give both at a time? Avranjanya drugs and Vat Shaman drugs. Can we give at a time, or
No,
should we first?
Actually, the classic says that Hitva Avaragam Agredu. Hitva Avaragam Agredu Vade Vataharikriya. It is very clearly he said, Hitva Avaragam Agredu, which is causing obstruction, it should be treated. Okay, you know the pathology, Sangha, Vimarga, Gamana, different things will happen. So Sangha, which is causing dosha, it may be Anya dosha or it may be something else. Okay. So it should be treated first. It should be removed. So normal gadi of Vada will be attained. After that, one has to go for Vadahara Kram, Hitva Avaragam Agredu, Vade Vadahara Kriya. After that, Vadacha line of treatment should be adopted.
Okay, okay. Thank you.
जी, और किसी को क्वेश्चन पूछना है तो पूछिए, नहीं तो हम सर.
Sir, one question is from my side.
जी.
Sir, sometimes spinal tapping there is done, then high protein is found, then we detect that there is no CP. In CP patient, there is no protein found in spinal tapping. So when there is need of doing spinal tapping.
Madam, can you repeat the question once more?
When there is a need of spinal tapping, when we have to diagnose the CP, because in spinal tapping,
you are asking about a CSF analysis.
Yes, yes, investigation. Because if we analyze depending upon the clinical presentation, either it is DMD or CP, but when there is need of spinal tapping, sometimes spinal tapping is suggested, and if there is high protein concentration, then it is not going towards CP. We said that. So when there is need doing of
spinal tapping, as per my knowledge, spinal tapping and all we used to do for normally used to do for ruling out meningitis and all.
Also, sir, for motor neuron disease also we do.
So I don't have any experience. Sorry.
Okay.
Dr. Saroj Desai ma'am.
नमस्ते सर.
जी.
सर ये बच्चे को ऐसे योग बस्ती आपने बोला, तो 1 साल का बच्चा हो तो उसको योग बस्ती तो कैसे दे सकते हैं?
Not 1 year. 1 year normally after 10 months we will practice Matra Basti. Matra Basti means it is nothing but Anuvasana Basti only. The quantity will be very less. Matravat. Matravat means it may be the matra for the child. So normally matra, how we will decide 1 yama, how much quantity of grida can be digested. That will be the matra. So it will be decided depend upon the child. Okay, depend upon the child. Approximately we give if it is a 10-month-old child, we go for 15 to 20 ml maximum. So that itself is sufficient to improve the symptoms. Okay, and if it is an elder child, sometimes it may vary from 20 ml to 60 ml.
और सर मेरा एक क्वेश्चन है कि प्रेगनेंसी में भी हमें क्या ध्यान रखना चाहिए और कौन सी औषधि देनी चाहिए कि ऐसा चाइल्ड ना हो?
No, that is very relevant question, because in pregnancy, ultimate a pediatrician having much role in pregnancy. So pregnancy, you should say that Masanumasika, Garbha, Charya and all, they explain, you can follow that. So any extra drugs, the crucial period is first trimester. First trimester, that also first 20 weeks you can consider, or first 3 months you can consider, 90 days you can consider. So this time mainly organogenesis, you know, from a single cell, a trilaminar becoming trilaminar, from there neural cleft is formed, from there again, you know, ectoderm, endoderm, mesoderm, everything is formed, and from there organogenesis will happen. This time, if the lady is suffering with a simple viral infection, if the lady is taking abnormal ahara vihara, okay, these all cause again vata prakopa, and there will be abnormality in the child. So mainly the first 3 months is very crucial. So last month, a cerebral palsy, an autistic child mother, she was saying that she will come and get admitted in our hospital. Then later she told that she is 2 months over. So I told that, please, you don't come and get admitted now, because it's not the right time. Because any sort of infection in the first trimester, it may be a torch infection or it may be something else. It may be a toxoplasmosis, a infection inside the lady. It may be cytomegalovirus, it may be a toxoplasmosis, or it may be a varicella, or it may be a rubella. Any sort of infection which may cause a abnormal organogenesis. You know, cytomegalovirus, 100% if the child is positive for IgG immunoglobulins, again, the child will be having microcephaly as the presentation. So these all are very important. You should remember. And again, if the lady is taking some anti-epileptic drug, if the lady is not taking proper thyroid drugs, these all will cause abnormal neural tube differentiation. It may be anencephaly or microcephaly or neural tube defects will be the outcome. So it is very important, very important in the pregnancy period, that also first trimester, you have to think what to be given and what not to be given, and how to keep the disease under control in a pregnant lady. It's very important.
और सर उसका 5th month और 6th month में हम ऐसे ब्रेन टॉनिक ड्रग्स से, ब्रेन टॉनिक हमारी औषधि है, ऐसे संपुष्पी है, ब्राह्मी है, ऐसा दे सकते हैं?
No, actually 6th month is a period for pre-eclampsia and eclampsia. Think about modern sense. So Ayurveda also very clearly says one has to go for this what we say Shatavari and Gokshura. Shatavari and Gokshura should be Gokshura should be given. So I feel that whatever Acharya said is more practical, because there is chances of increased blood pressure in the lady. It should be checked. It should be checked, because more amount of volume can also produce hypertension. If hypertension, pregnancy induced hypertension, if the lady is suffering with hypertension, that is pregnancy induced hypertension, there is chances of IUGR baby, intrauterine growth retardation. And if there is IUGR, again there is chances, if because of maternal hypertension, if some thrombus is formed which is entered into the brain of the baby, there may be hemiplegic presentations. If the hypertension is not under control, it may cause capillary bleeding in the growing brain. Again, there will be hemiplegic CV presentation. So these all complications can happen. So normally Acharya said go for Gokshura Kashaya. So that is ideal. Why you want to add again Medhya drugs? If you want a good child, a Buddhiman child, after delivery you practice Varna Prashana. You can go for it because Acharya says Suvarna Prashna Medhakti Belavartanam Ayusham Mangalam Punyam Vrishyam Varnyam Grahapaham Masat Paramamedhavi Yadi Purnaja Drishyade Shadbir Mase Shruta. Very clearly Acharya explained. So you can follow that one. Why you want to give in the pregnancy?
थैंक यू सर. और सर ये ज्योतिषमती तेल, हाँ ज्योतिषमती तेल का भी हम यूज कर सकते हैं ऐसे सीपी चाइल्ड में, ज्योतिषमती का अपने
Jyotishmati, actually Jyotishmati Taila in some region they are using, but practically speaking I am not using Jyotishmati Taila. In some area, some CP centers they are using Jyotishmati Taila.
थैंक यू सर.
Okay मैडम
जी. और किसी को कोई क्वेश्चन पूछना है क्या सर
हाँ
से?
सर, मुझे एक और क्वेश्चन पूछना है.
हाँ पूछिए.
सर आपने अभी बताया था कि फर्स्ट हमें जब बेबी होता है तो मदर से पूछना चाहिए कि वो उसने क्राई किया था या नहीं किया था, और वो रिस्पिरेटरी डिस्ट्रेस में गया था या नहीं गया था, तो उसको हमने कैसे रिलेट करना चाहिए सेरिब्रल पाल्सी से? क्या दोष और संप्राप्ति का विचार करना चाहिए अगर वैसा होता है तो?
No, actually it is not dosha samprapti. It's simple thing. One question we are asking whether the child cried immediately. It is nowhere related with dosha. You think this one? Cry is the spontaneous respiration activation. So when the child cries, then suddenly when the child is coming from a fluid media to air media, fluid media, the child is lying inside the amniotic fluid. The child is coming to the air media, and suddenly the child was supplied by our umbilical cord. It was clamped. It was clamped means there will be sudden some changes inside the body, and the vagus nerve will get stimulated because of the sudden atmospheric temperature. So suddenly there will be a diaphragm will suddenly work. So it will show like a cry. So the first respiration itself will be shown as the cry. So if the child is crying very loud, you see that APGA or Apgar scoring. Again, if the child is having loud cry, you give 2 marks. If the child is having feeble cry or a shrill cry, you give 1 mark. And if the child is not active, you give 0 mark. So it is very clearly indicates the cry indicates the respiratory system function. So till now I was saying that if the respiratory system is not functioning, I told about IRDS, idiopathic respiratory distress syndrome. I said about surfactant. I said about hyaline membrane disease. These all are happening at the time of birth. If a preterm baby, if it is happening, or a term baby, if it is happening, what will happen? In turn, it will cause anoxia or hypoxia in the brain. So once the hypoxia is formed, further there will be ischemia. If the ischemia is not corrected with the active resuscitation. Resuscitation means bringing back life in a dying child. So suddenly you may start with your stimulatory methods. You may wipe the baby, you may cool the baby, you may warm the baby, then suddenly you may stimulate the baby, you may position the baby. After that also, if the child is not having respiration, you will start with the positive pressure ventilation. If there is no again live sense, you will start with cardiac massage with positive pressure ventilation, and you will start with some medicines like epinephrine, or if acidosis is there, you may start with soda bicarbonate. Some sort of medicines will be utilized for a resuscitation purpose. So these all are for activating the respiration or maintaining the balance. It should not be acidosis, or it should not be alkalosis. Both are pathological. To maintain that, you will be practicing this one. Okay. So once, if you attain respiration, if the heart rate is more than 100, if the heart rate is more than 100 and the baby is pink, clearly you can say that the baby becomes stable. Okay. So cry, why I told, you will be asking few questions at the time of first. Apgar, I was saying about Apgar scoring. So there is some limitations of Apgar. Apgar will be seen after 1 minute only. Every 5 minutes you will be calculating Apgar scoring. I was saying out of 10, 5 for that child. So Apgar, instead of Apgar scoring, there is a question, 4 questions: whether the child cried immediately, whether it's a term gestation, whether the amniotic fluid is mixed with this one meconium. Meconium is the first stool of the child. few questions you will ask. Every question, if it is yes, no, the child is normal. If there is some out of 3 or 4 questions, 2 are no, then the respiration also you will see, color of the child you will see, you will see the heart rate, and you will plan the further whatever I told, positive pressure ventilation and all. This is called resuscitation. When you are planning, when there is no birth cry, when there is no birth cry, it is directly says about the respiratory system. So I told a simple question, by asking a simple question, you can exclude hypoxic events in the child. It's clear, right, madam?
Yes, sir. Thank you.
Okay.
और किसी को क्वेश्चन पूछना है क्या? नहीं तो डॉक्टर दीप्ति जी सर को वोट ऑफ थैंक्स बोलिए.
Okay, sir.
Sir, Nair sir, how you are feeling after coming on this platform? Please
Very
share your
good.
experience.
First of all, Dr. Naveen Joshi sir, you are very active and very good. You are doing something. Actually, you are making improvement of knowledge in Ayurvedic doctors, and mainly you have conducted one national seminar, international seminar also in Nepal. So you are doing much work in Ayurvedic field. I am very happy.
Ji. Sir is not present, sir. Naveen Joshi sir has gone now.
Yes, gone.
Okay. Dr. Dipti ji, आप वोट ऑफ
Okay,
थैंक्स
sir.
बोल दीजिए
Yeah.
सर को.
Thank you, Nair sir, for your nice explanation. You explained the 2 cases of CP with the evidence. Also, you explained the distinguishing signs of DMD and CP very nicely. So very nice of you, sir. You came here and you guided us very nicely. So very, very thank you, sir.
Thank you, madam.
Thank you.
And before ending, I want to thank entire core of Ayush Darpan, because I don't know personally, I know only Dr. Naveen Joshi. So,
Sir has come.
each and everyone
I am
has
present
come now.
here. I am very much thankful. As I think that you also visited Kathmandu.
No, sir, that time I have not visited. Only I have applied for that one.
But your friends, I
Yeah,
think
yeah, yeah.
your colleagues from
Dr.
your college, they
Dr.
visited,
Dharmesh.
I think.
Dr. Dharmesh, Dr.
Yeah.
Rajesh, many members.
Dr. Dharmesh,
visited.
yes. It's a very beautiful international
Yeah,
program in Patanjali College.
Yeah. Yeah, anyway, we are
So
very much
many
happy that
thanks.
you are
I
doing
think
something.
Dr. Vaidya Arvind Pathak ji, please give thanksgiving from Dr. Bogawar. Yeah.
उन्होंने कर दिया. उन्होंने
अरविंद
थैंक्स
जी?
बोल दिया. कर दिया सर.
So
जी.
thank you, sir. Thank you. Again, we will meet again for the new topic in the same platform. Thank you, sir.
Thank you
Okay,
very much,
thank
sir.
you. Thank you all. Thank you so
Thank
much.
you so much, sir.
Thank you. अभी हम लोग संभाषा कर लेते हैं. सर, you can stay here if you want to stay. अभी हम लोग संभाषा कर लेते हैं. अगर किसी को कुछ केसेस बताने हैं तो 15 मिनट्स है. डॉक्टर अंजलि जी, डॉक्टर सरोज जी, अगर कोई केसेस बताना है तो आप लोग कर सकते हैं. डॉक्टर अवनीता जी, हरिओम सर, डॉक्टर हरिओम सर, डॉक्टर पायल जी, संभाषा करना है तो कर सकते हैं. डॉक्टर खुशबू जी, डॉक्टर दीप्ति जी, कुछ बताइए केसेस.
सर अगर कोई क्वेश्चन पूछूं तो
पूछिए ना.
एक पेशेंट था थायराइडाइटिस का, टिपिकल वात पित्त प्रकृति पेशेंट है और उसको 1.5 साल से थायराइड ग्लैंड का एनलार्जमेंट है, 607 सेंटीमीटर है, बट उससे कोई दिक्कत नहीं हो रही थी. तो उनका कंप्लेंट है कि 4-5 डेज के अंदर में उसका इन्फ्लामेशन बढ़ गया, साइज भी थोड़ी बढ़ गई और उससे उनको स्वेलोइंग में थोड़ा सा डिफिकल्टी हो रहा है. सारे इन्वेस्टिगेशंस हो गए हैं, FNAC लेकर सीटी स्कैन तक, सारे नॉर्मल से, फिर भी उनको सर्जरी एडवाइस की है और पेशेंट विलिंग नहीं है सर्जरी के लिए. हेतु में उसका है कि उसको जॉन्डिस हो गया था 5-6 मंथ पहले और उससे पहले भी उनका हमेशा गैस्ट्रिक अपसेट रहता है, स्टमक अपसेट ही रहता है, तो पित्त प्रकृति बहुत है. तो उनको हम इमरजेंसी में क्या कर सकते हैं, थोड़ा सा वो सबसाइड हो जाए अगर स्वेलिंग, तो डिफिकल्टी स्वेलिंग ना हो जाए.
उपनाह स्वेद दे दीजिए. और दूसरा है कि कांचनार गुगुल बहुत अच्छा काम करता है. कांचनार गुगुल का यूज करिए. और आम पाचक वटी दे दीजिए. आपके पास है मेरा आम पाचक वटी, उससे बहुत जल्दी फायदा होगा. मतलब उनको मतलब स्वैलोइंग में तो बहुत अच्छा रिलीफ मिल जाएगा.
हाँ.
उसके बाद में थायराइड फार्मूला में वचा, पुनर्नवा और वो रानकांदा, जंगली प्याज, अमृता सत्व वो दे दीजिए, और कांचनार गुगुल से ही बहुत अच्छा फायदा होगा।
पर यहाँ पे संप्राप्ति सर हमेशा जो रहते हैं ना कि वात कफ, कफ प्रधान वात, ऐसी संप्राप्ति नहीं है, वात पित्त प्रधान है। तो
ठीक
भी
है,
मुझे
लेकिन
यही
वो
ड्रग
ग्रंथि
यूज
क्यों
करने
हुआ
हैं।
है, ग्रंथि क्यों हुआ है, वो उसमें क्या संप्राप्ति है?
हाँ, आम का ही आवरण है, आम है, क्लेद है, बना है वात की वजह से। और हाँ, रस व स्रोत से उनका दूषित है, हमें मतलब रस शेषा जीर्ण के लक्षण है उनको हमेशा रहती थे, यही
तो
कॉज है
इसीलिए
उनका।
मैंने आम पाचक वटी बताया। आम
हाँ हाँ
रसव स्रोतस पे काम करना है तो रस पाचक दे दीजिए, मांस पाचक, मेदो पाचक ऐसे दे दीजिए।
हाँ हाँ। और लोकल उपनह जो किसका करना है?
उपनाह में वो उपनाह स्वेद बताए ना कि तिल लेना है, फिर वो ये क्या क्या बोला है, जौ लेना है, अतसी लेना है,
अति उपनह
अलसी।
बोल रहे हैं आप?
हाँ, अतसी उपनाह, उससे बहुत अच्छा
तो
फायदा होगा।
इन्फ्लेमेशन कम हो जाएगा उससे?
100%। और इन्फ्लेमेटरी कंडीशन है तो त्रिफला गुगुल, कैशोर
हाँ
गुगुल,
हाँ हाँ।
ये सब अच्छा काम करता है।
ओके ओके, क्योंकि सर्जरी भी
सर नायर सर, कैन यू
है।
टेल ट्रीटमेंट इन दिस? नायर सर,
So normally we practice Kanchanara Gugulu along with Varunadi Kashayam. Varunadi
yes
Kashayam
yes,
is a good
वरुणादि कषाय
preparation.
जी।
Varunadi Kashayam along with Kanchanara Gugulu, if you give any sort of arbuda or granthi, it is very effective.
और वो जो रौद्र रस है उसका भी बहुत अच्छा रिजल्ट आता है, भेषज रत्नावली, अर्बुद रोगाधिकार, उससे बहुत अच्छा रिजल्ट आएगा। और पूछिए दीप्ति में। और रक्त मोक्षण से तो बहुत अच्छा फायदा होता है। मैंने ऐसे पेशेंट में ना 8 जलौका लगाया था, लीच थेरेपी, बहुत अच्छा, एकदम इमीडिएट वो साइज कम हो जाता है।
हाँ, रक्त दुष्टि है बिल्कुल सर उसमें, इसीलिए वो इन्फ्लामेशन एकदम से 4-5 दिन में बढ़ गया, तो रक्त दुष्टि होगी।
हाँ, जलौका लगा दीजिए, बहुत अच्छा फास्ट रिजल्ट आएगा।
ठीक है ठीक है।
किसी ने वृद्धिवादी का वटी के बारे में बताया, वो भी बहुत अच्छा काम करेगा। ठीक है, डॉक्टर सरोज जी आप प्रश्न पूछिए। डॉक्टर दशरथ जी कुछ बताइए अपने केसेस। डॉक्टर मुनीरा जी, डॉक्टर गंगवार सर।
हाँ सर नमस्ते, मैं एक सवाल सर पूछना चाह रहा हूँ सर। ये मेरा पेशेंट है सर, 17 ईयर ओल्ड फीमेल है सर। तो उसे सर उसका हेतु जो है सैक्रो MRI में जो कराया है उन्होंने, उसमें सैक्रोइलाइटिस निकल के आया है सर
जी।
और हेतु है सर उसका फास्ट फूड बहुत ज्यादा खाती थी वो लड़की, अभी चलना भी मुश्किल हो रहा था उसे, इतनी ज्यादा उसकी क्या कहते हैं स्वेलिंग है और अंदर से पेन है। तो सर मैंने उसे सर कोटम चुकियादी चूर्ण से उसका जो है बाह्य शोधन कराया है, और ये आपका आम पाचक काढ़ा दिया, आम पाचन काढ़ा दिया है, सिंगनाथ गुगल दिया, आम बाताई रस दिया है सर, और आम बातरण कसाया जाता है ये दिया है सर। और क्या दे सकते हैं सर?
सैक्रोइलाइटिस में इन्फ्लेमेशन है।
हाँ सर सैक्रोइलाइटिस है।
हाँ, कुट्टम चुकियादी चूर्ण का बहुत अच्छा फायदा होगा। नायर सर कैन यू टेल समथिंग अबाउट दिस सैक्रोइलाइटिस में, आप क्या सजेस्ट करेंगे? नहीं तो खुशबू जी आप बताइए, कोई और बताना चाहते तो बताइए, नहीं तो मैं बाद में लास्ट में मैं बताऊंगा। किसी को बताना है? हरिओम सर आपको बताना है क्या सैक्रोइलाइटिस में क्या दे सकते हैं? ठीक है, तो मैं बताता हूँ। इसमें ना इंफ्लेमेटरी कंडीशंस रहती है ना, तो हम लोग ज्यादातर ये देते हैं, अमृता गुगुल, कैशोर गुगुल, त्रिफला गुगुल, इससे बहुत अच्छा फायदा होता है। पहले आम का पचन करना है और इंफ्लेमेटरी कंडीशन है उसको ठीक करना है, और उसके बाद में फिर बस्ती देने से बहुत अच्छा फायदा होता है। तो अगर वहां पे ना बहुत ज्यादा स्टिफनेस है, स्तंभ है, उत्तम चुक्यादी तेल, अगर वहां पे पेन है तो वहां पे शीर बला तेल, उसका बस्ती, मात्रा बस्ती बहुत अच्छा फायदा करेगा।
मात्रा बस्ती सर।
हाँ, और इंटरनली ना अग्नि अगर अच्छा हो गया तो नरसिंह रसायन, फिर गुगुल तिक्त घृतम बहुत अच्छा काम करता है। और ये अष्टमज्जा वाचक गुगुल कल्प का ज्यादा अच्छा रिजल्ट आएगा मेरे को तो आता है। स्वर्ण युक्त भस्म में अगर वहां नर्व्स को अच्छा करना है तो मेघवा चिंतामणि रस, त्रैलोक्य चिंतामणि रस बहुत अच्छा इफेक्टिव है। और
सर ये स्वर्ण भूपति रस सर कैसा रहेगा?
स्वर्ण भस्म तो अच्छा काम करेगा, एंटी
स्वर्ण भूपति रस सर।
हाँ बहुत अच्छा है, स्वर्ण भूपति भी अच्छा काम करेगा,
क्योंकि सर आम बात अधिकार में है ना सर, रोग अधिकार में तो
मालूम है। स्वर्ण भूपति में यूज करता हूँ, बहुत अच्छा रिजल्ट आता है। पहले में निकालिए कि उनका जीर्ण ज्वर का इतिहास तो नहीं है ना? अगर जीर्ण ज्वर रहा और ये सैक्रोइलाइटिस में कन्वर्ट हुआ तो जय मंगल रस बहुत अच्छा काम करेगा।
अच्छा सर। नहीं सर, उसकी हिस्ट्री यही थी, जैसे उन्होंने बताया था, उसके फादर ने बताया था कि ये पहले फास्ट फूड बहुत ज्यादा खाते,
तो उनका हेतु परिवर्जन करिए और थोड़ा शोधन करा दीजिए।
तो मैंने तो
मृदु
अभी आम
विरेचन।
पाचन के हिसाब से दिया है सर ये सब है।
जी
जी सर।
जी,
तो
बहुत
सर इससे
बढ़िया।
बाद में अगर इसे क्या कहते हैं, अगर ये आम बात की कंडीशन थोड़ी खत्म होती है, स्वेलिंग खत्म होती है, पेन खत्म होता है, तो सर इससे वो दे सकते हैं, क्या कहते हैं, स्नेह स्वेदन वगैरह कर सकते हैं सर?
100% कर सकते हैं। मैंने तो मात्रा बस्ती बोला।
जी सर।
सर इसमें कुछ ऐड करना चाहती हूँ, जब अभी
हाँ।
पेन ज्यादा रहता है ना ये कंडीशन में, और आम भी है, तो पत्र पोटली स्वेद लोकली अच्छा काम करता है, पेन भी कम करता है, स्टीफनेस भी कम करता है।
पत्र पिंड स्वेद, मैडम कौन से तेल से?
पत्र पोटली स्वेद मालूम है क्या गंगवार
पत्र,
सर?
अर्क पत्र, शिग्रू पत्र, जो भी
हाँ सर
अवेलेबल
मालूम है। हाँ नहीं तो कोई किसी न किसी तेल में तो सर उसे क्या कहते हैं फ्राई करना ही पड़ेगा सर ना।
हाँ सरसों के तेल में बहुत अच्छा
फ्राई
फायदा है।
करके
या सर कोटम चुपका दी तेल के अंदर फ्राई करते तो सर कैसा
हाँ,
रहेगा?
उसी से काम हो जाएगा सर।
कोटम चुकादी में भी कर सकते हैं, सैचुरादी में भी
मैंने
कर
तो
सकते हैं
कोटम चुकादी का मात्रा बस्ती दिया है, इतना अच्छा फायदा होता है ना सैक्रोइलाइटिस में, इतना अच्छा कि क्या बताएं। जी
तो इसमें कटी बस्ती भी ले सकते हैं ना उस साइड पे।
हाँ, लेकिन वो पेशेंट सो पाएगा क्या? इतना सैक्रोइलाइटिस में इतना पेन होता है, सो पाएगा इतना देर तक?
15 मिनट के लिए, 15 to 20 मिनट्स।
हाँ, कंडीशन देख के कर सकते हैं।
हाँ, आम
सीवियर कंडीशन है सर उसकी, और सर उसकी मसल वास्टिंग टाइप भी हो गई है, क्योंकि वो चिंता कर रहे हैं, उसके माता पिता भी बहुत
मसल
चिंतित हैं
वास्टिंग है
और-
तो आप तो ये स्वर्ण मालिनी वसंत और ये अश्वगंधा लेहम खिला दीजिए, बहुत मस्त, पेशेंट का मसल्स पूरा स्ट्रांग हो जाएंगे।
जी सर।
अश्वगंधा लेहम बहुत अच्छा काम करता है।
जी
तो सर इसका कॉज क्या होता है सैक्रोइलाइटिस का?
वहां पे इन्फ्लेमेशन हो गया, वात का प्रकोप है, कफ का ये हुआ है, दुष्टि हुआ है। आयुर्वेद के हिसाब से इन्होंने कहा ना जंक फूड बहुत खाती थी, वातवर्धक आहार विहार, सब दोष प्रकोपित करने वाले आहार विहार का सेवन हो रहा होगा, रात्रि जागरण हो रहा होगा, वेगों का धारण किया गया होगा।
जी सर। कॉन्स्टिपेशन सही सीवियर था, तो अभी मैंने वही दिया सर उसे, और त्रिबत लेहम दिया है रात को।
और जंक फूड खा रही है, मतलब विरुद्ध अन्न का सेवन हो रहा है, तो ये सब तो हो गई ना, विरुद्ध अन्न
अच्छा
का
सर,
सेवन।
हाँ सर,
बहुत
जंक
ज्यादा।
उसकी
अच्छा
मेन
सर,
हिस्ट्री है जंक फूड की।
जी। अच्छा
जंक
सर,
फूड में
बहुत
क्या ज्यादा क्या खाती हैं जंक फूड में?
मैगी, चाउमीन
और
पिज्जा वगैरह तो जी खाती है, मैगी चाउमीन की मेन हिस्ट्री है सर।
जी हाँ शुक्ला जी, आप बताइए सर।
हाँ सर, मैं ये पूछ रहा था कि बहुत ज्यादा देर तक बैठने से या गलत ढंग से बैठने से भी हो सकता है ये सैक्रोइलाइटिस?
100% वो एक निमित्त कारण हो गया, लेकिन मेन खाना पीना गड़बड़ है, वो भी है, दोनों चीज है सर।
ओके सर, ओके, थैंक यू।
और ऐसे सैक्रोइलाइटिस में कभी कभी वातरक्त की भी संप्राप्ति रहती है, वहां पे जॉइंट्स में वातरक्त भी देखना चाहिए कि रेडनेस है क्या, स्टिफनेस, मतलब वहां पे वातरक्त जैसे सिम्टम दिख रहे हैं क्या, वो देखना चाहिए। तो तिक्तक क्षीर बस्ती का बहुत अच्छा रिजल्ट आता है, कैशोल तिक्तक क्षीर बस्ती
रक्त मोक्षण भी इसमें अच्छा काम करता है।
बहुत अच्छा काम करेगा। जी डॉक्टर खुशबू जी, आप कुछ बता रही हैं? थैंक यू डॉक्टर खुशबू जी।
हेलो।
हाँ प्रणाम। राधे श्याम जी, आप कहाँ से हैं सर?
जी सर, मैं काला पीपल से हूँ, शाहजहाँपुर एमपी।
जी
सर, क्वेश्चन था मेरे पास एक पेशेंट है, फीमेल पेशेंट 26 इयर्स की, और उसको सर कभी कभी नोजिया और वोमिटिंग उल्टी जैसा मन करता था, खास करके रात को खाना खाने के बाद। और उन्होंने डॉक्टर को कंसल्ट किया तो उन्होंने उसका ग्लूटीन एंटीजन टेस्ट कराया था, जिसमें वो पॉजिटिव आई, तो उन्होंने उसको गेहूं खाने के लिए मना किया। सर इस केस में अपन गेहूं की एलर्जी या ग्लूटीन प्रोटीन की जो एलर्जी है, इस केस में अपना लाइन ऑफ ट्रीटमेंट क्या होना चाहिए एग्जैक्ट?
ग्लूटेन एलर्जी है तो पहले शोधन कराइए। आम का पचन हो गया तो ग्लूटेन एलर्जी नाम का कोई चीज ही नहीं है, अग्नि को बढ़ा देंगे ना तुरंत ठीक हो जाते हैं। 3-4 महीना दवाई दीजिए
जी।
हाँ, तो आम पाचन करना पे ध्यान दीजिए, सब कुछ पचने लगा तो ये ग्लूटेन एलर्जी नाम का कोई कॉन्सेप्ट ही नहीं है।
जी 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 सर, ओके सर,
थैंक यू।
प्रणाम सर।
थैंक यू सर।
हाँ खुशबू जी, पूछिए प्रश्न।
प्रणाम सर। सर मुझे
आप कैसी हैं? आपकी बेटी कैसी है?
सर वो वैसी ही है अभी तो। उसका स्टोन का साइज डबल हो गया है अभी विद इन अ मंथ। अभी तो पेन अभी नहीं है, लेकिन बीच में काफी था, बट अब स्टेबल है। पर वो स्टोन तो है ही।
आपके घर
सर
में टीवी की आवाज किसके घर
नहीं
में
सर,
है?
मेरे घर में नहीं है, ये कहीं और
राधे
से
श्याम
आ
जी के घर में से टीवी की आवाज आ रही है।
जी
जी।
सर।
हाँ बताइए खुशबू
सर
जी।
मुझे केस पूछना था एक्चुअली।
पूछिए।
आप या फिर दीप्ति मैम ने भी ऐसा केस किया हुआ था, तो वो सेम ही है। मैं सर पित्तज ग्रहणी का केस है मेरे। तो उनको सर मैंने ये पित्तज ग्रहणी का उनको वही सारे सिम्टम्स थे, जैसे कुछ भी खाते थे तो मोशन होना, ये सब चीजें था। तो मैंने उनको पंचामृत परपटी, कामदुद्धा और सूचेकर शुरू किया, और कुटजारिष्ट, बेलवावले, ये सब चीज शुरू की थी। और शुरू में पहले उनका आम पाचन भी कराया था, लेकिन वो स्टेबल तो हो गए। लेकिन वो चीजें जब दवाई चल रही है वो चल रहा है, तो 1 महीना हो गया उनको। लेकिन जैसे अभी मैंने उनको दूध वगैरह सब बंद करा रखा था, तो 1-1.5 महीने से दवाई ले रहे थे, तो कोई मोशन वगैरह सब सही था। लेकिन कल रात को उन्होंने दूध पिया, वापस से उनको फिर 3-4 मोशंस हो गए। तो सर ये कितने दिन तक मतलब पित्तज ग्रहणी का हमें ये चलाना पड़ेगा ट्रीटमेंट?
पित्तज
और
ग्रहणी कभी कभी 6 महीना लगता है, कभी कभी 1.5 साल लगता है।
तो सर ये दवाइयाँ मतलब सेफ है, चला सकते हैं इतने लंबे टाइम तक?
हाँ चला सकते हैं।
अच्छा।
आरोग्य वर्धिनी जैसे रसकल्प है, इसको 42 डेज देके ब्रेक करिए।
बस पंचामृत परपटी, सूचेकर रस और कामदुद्धा ये है सर। मतलब
तो
इसकी
दे
मैंने
सकते हैं,
पुड़िया
परपटी कल्प
पुड़िया
को दे
बना
सकते
के।
हैं। जी दे सकते हैं।
अच्छा, बाकी तो
मैडम इसमें ना
और
कपर्दिक भस्म ऐड करिए, जो सर के आवेचा योग है ना उसमें है, तो आपके
वो,
इसमें
हाँ
कपर्दिक
मैम वही मैंने क्या दिया था, तो
कपर्दिक
उसमें
ऐड करो।
जी। अच्छा, शौक्तिक
और
भस्म, हाँ मैंने शौक्तिक भस्म ऐड की थी मैम। वो आवेचा
प्रमाण
योग ही
पंचामृत भी
मैंने।
ऐड करो। प्रमाण पंचामृत भी अच्छे से एब्सॉर्ब करता है वो प्लेद और लिक्विड, तो प्रमाण पंचामृत भी ऐड करो। थोड़ी दिन के लिए आम पाचक भी चला। और कूटजारिष्ट, अगर पित्त के लक्षण ज्यादा दिख रहे तो मतलब मुझे ऐसा लगता है कि मैं भूनिम्बादी काढ़ा या फिर चिरायतादी काढ़ा, ये ज्यादा अच्छा काम
हाँ
करता है।
चरक
पित्त
संहिता
तो
का
पहले था मैम, अब पित्त तो नहीं है
पर अगर
उनको।
अग्नि अच्छा है तो कूटजारिष्ट मत दो, आप बिल्वावली दे रही है ना?
हाँ बिल्वावले मॉर्निंग में, रसायन काल में दे रही हूँ मैम।
इवनिंग को भी तो दो ना, 2 टाइम्स कर दो, बहुत अच्छा रिजल्ट आता है।
ओके। और मैम एक मैं उनको पंचतिक्त घृत भी दे रही थी, मतलब खाना खाने से पहले, ताकि अगर कोई जैसे वुंड अंदर कुछ अल्सर्स वगैरह हो तो वो हील अप हो जाए, तो वो भी सही है मैम?
नहीं आप क्यों मतलब यूएसजी हुआ है, क्यों लग रहा है
एक्चुअली
अल्सर?
उनका नहीं, वो सब तो ऐसा कुछ नहीं था। वो कभी कभी पेट दर्द की बताते थे, तो मुझे लगा कि क्योंकि उनको काफी जैसे हिस्ट्री मैंने ली थी, तो ऑलमोस्ट 6 to 7 months पहले से ये प्रॉब्लम थी उनको। लिया ऑन ऑफ ऑन ऑफ ऑन ऑफ चल रहा था, दवाई ले रहे थे। तो फिर वो कभी कभी पेट दर्द की भी बता रहे थे, तो मैंने ये सब चीजें, तो मैंने घृत भी ऐड करा। पहले मैंने नहीं किया था, तो उनको मोशंस वगैरह तो रुक गए थे, लेकिन वो पेट दर्द की बोलते थे। लेकिन जब से मैंने ये पंचतिक्त घृत खाना खाने से पहले किया ना, तो उनको पेट दर्द की भी प्रॉब्लम अब सॉर्ट आउट हो गई, पेट दर्द भी नहीं होता है। तो मुझे लगता है कि वो शायद वो लुब्रिकेट कर देता है और हील अप भी हुआ होगा।
इनमें ना
तो वो
वात
अच्छा
बहुत ज्यादा बनता है ये पेशेंट में ना, इसलिए उनको पेट दर्द का शिकायत होता है। वात कंटिन्यू बनते रहता है और बार बार आम भी बनता है, तो इसलिए आम पाचक भी रखना आप थोड़ा थोड़ा।
ओके। तो अच्छा, मैं वापस शुरू करूं, क्योंकि मैंने एक बार 10 दिन तक उनको देखे, फिर ये तो बंद कर दे, क्योंकि हम वो बोलते हैं कि ना मुझे इतनी भूख लगती है कि रात को नींद खुल जाती है। ऐसा लगता है कि ना मुझे रात को उठ के खाना पड़ता है,
हाँ
ऐसा।
तो
तो
तीक्ष्ण हो रहा है ना
मैंने
उनका।
फिर उनका वो तो बंद कर दिया, मतलब वो सब चीजें। तो बट ये हाँ, पुड़िया तो दोनों सुबह शाम ये चल रही है। मुझे लगा कि आम पाचक तो पाचन हो गया, अग्नि भी प्रदीप्त हो गई, तो वो तो मैंने बंद कर दिया। अब वो वापस चलाऊं क्या मैम?
नहीं नहीं, अब अग्नि अगर अच्छा है ना तो, और इनको ज्यादा
नहीं,
ज्यादा भूख
अच्छा है,
हो रही
उनको
तो
भूख बहुत अच्छे से लगती है। मतलब बोलते हैं कि मुझे तो ऐसे मतलब होता है ना कि 4-5 घंटे बाद भूख लगना, उनको तो जैसे एक मील लिया उसके 2 घंटे बाद में ही वापस से भूख लग जाती है, ऐसा।
ठीक है ना, तो घृतपान करवा रही है, अच्छा है। और आप थोड़े दिन के लिए मौक्तिक कामदुधा स्टार्ट करिए, तो और उनका दाह जो है ना, बार बार भूख
मैम वो
लगना,
चल रहा है, वो मैंने उसमें पुड़िया में ऐड कर
मौक्तिक
रखा
वाला
है।
चल रहा है, सादा वाला चल रहा है कि मौक्तिक वाला चल रहा है?
मैम मौक्तिक बस उसमें ऐड करिए, मैं मौक्तिक नहीं शौक्तिक, वो मुक्ता
नहीं, मौक्तिक कामदुधा भी आता है ना, वही मैं बोल रही हूँ।
अच्छा मौक्तिक कामदुधा,
हाँ।
सिंपल वाला कामदुधा ऐड किया हुआ है उसमें मैंने, सूचकर कामदुधा, वो जो आवेचा योग था ना
हाँ,
IBS का सर का, वो वाला शुरू किया हुआ है। तो उसमें मतलब अभी वही मैं साथ में ये भी थोड़ा डाउटफुल थी कि कितने टाइम तक चला सकते हैं इस ट्रीटमेंट को।
ज्यादा दिन चलाना पड़ता है, गृहिणी को नॉर्मलाइज होने में टाइम लगता है, तो इसका कोई
तो
नुकसान
ये
नहीं होता
नॉर्मल
है।
मतलब ये है, वरना और कोई जी
उसमें आप यष्टि मधु ऐड करो, यष्टि मधु, थोड़ा शतावरी, गैरिक ऐड करो, गोदंती ऐड करो, सारे पित्त शामक थोड़े और ऐड करो, तो और अच्छा रिजल्ट आएगा।
जी
मैम इसमें एक बताऊंगी मैं कि पित्त, क्योंकि पित्त का स्थान नाभि बताया गया है ना, तो इसमें आप नाभि पूरण करेंगे ना शुंठी सिद्ध तेल का, तो उससे भी अच्छा इफेक्ट आएगा।
जी मैम, ओके मैम। शतावरी, यष्टि मधु और गैरिक, और क्या बताया था आपने?
गोदंती, गोदंती,
गोदंती। तो ये उस पुड़िया में ही ऐड कर दूं मैम या अलग से?
उसी में ऐड कर दो।
और वो चलने दूं कम से कम अभी 1-2 महीने और चलने दूं ना?
हाँ बिल्कुल, इससे कोई नुकसान नहीं होता है।
जी ओके।
मेरा
वैसे
भी
उनको
ऐसा ही
ट्रीटमेंट से फर्क तो काफी पड़ा है मैम, क्योंकि पहले तो बहुत ज्यादा लिथार्जिक थे वो, और वही आपने जो बोला उनमें सब चीजों की सही में कमी आई थी, वो टेस्ट कराया था तो मैंने,
डिफिशिएंसी आती है ऐसे पेशेंट में।
डिफिशिएंसी आई थी, यस मैम। तो अभी इन्हीं से सब कुछ पूरा हो जाएगा या फिर उसके एडिशनल हमें कुछ
इन्हीं से
करना
हो
पड़ेगा?
जाएगा, अगर आप चाहे तो ये तिक्त घृत का मात्रा बस्ती देते हैं तो और आपको जल्दी रिजल्ट आते हैं। अगर पेशेंट इसी पे कंफर्टेबल है तो यही करवा लो, आपको टाइम अगर जल्दी कराना है तो पंचतिक्चर का मात्रा बस्ती बेस्ट काम करता है।
ओके मैम।
हाँ, थोड़ी दिन भी दोगी,
मेरा
10-12
भी
दिन, तो काफी फास्ट फायदा मिलता है।
हाँ नहीं, पंचतिक्र से तो मैम एक और बहुत अच्छा इससे उनको इफेक्ट हुआ है कि उनको ना थोड़ा थोड़ा इचिंग का भी प्रॉब्लम था, बीच बीच में रेडनेस हो जाती थी, वो भी सॉर्ट आउट हो गया है, स्किन फट रही थी, काफी एडिशनल रिजल्ट भी मुझे मिले, तो पेशेंट बहुत खुश
डेफिशिएंसी भी
था।
आया होगा ना पेशेंट में, तो वो भी कम हो जाता है पंचतिक्त की मात्रा बस्ती से। B12 डेफिशिएंसी आता है ऐसे पेशेंट में, विटामिन D कम आता है, वो भी अच्छा हो जाता है।
ये तो शायद मैम ये कवर अप हो जाएगा क्योंकि हम कैल्शियम के इसमें बहुत सारी चीजें ऐड कर रखी है ना, तो वो हो जाए। और दूध फिर अभी बंद ही रखूं ना मैम उनका?
हाँ
जी ओके, थैंक यू वेरी मच मैम।
मेरा भी ऐसा ही पेशेंट है, वात कफज ग्रहणी का है मेरा, तो मैंने भी दवा दी, लेकिन बीच बीच में ऐसा आप बोलते हैं ना कि कुछ खा लेता है तो ऐसा हो ही जाता है, उनको फिर से हो जाता है। लेकिन मेरा ये क्वेश्चन था कि वो हम पंचामृत पर्पटी कंटिन्यू दे सकते हैं, ब्रेक नहीं लेना चाहिए?
पंचामृत प्रॉपर्टी क्यों नहीं दे सकते?
कंटिन्यूस सर कितने दिन दे सकते हैं ऐसे कंटिन्यूस?
आप पर्पटी से इतना डर रहे हैं तो 42 डेज देके ब्रेक करिए, 7 दिन फिर दे दीजिए।
हाँ, और सर कभी कभी क्या है, वो खाने से उसका पेट भी भारी हो जाता है, ऐसा होता है, अग्निमंद हो जाती है।
तो आम पाचन करा दीजिए।
हाँ वो तो मैं कराती हूँ, लेकिन कुछ ऐसा खा लेते हैं तो फिर प्रॉब्लम हो जाती है
जी।
और सर उसको ऐसे पंच कर बस्ती में हम किसकी बस्ती दे? वात कफज ग्रहणी है उसको,
तो कोई भी शीरबला तेल का दे दीजिए, तिक्तक शीर बस्ती दे दीजिए, वो कफ को तो ठीक करेगा ही, शीर बस्ती अच्छा काम करेगा।
शीरबला तेल ना सर?
शीरबला तेल या तिक्तक शीर बस्ती,
शीरबला तेल की हाँ तिक्तक शीर बस्ती,
2 ऑप्शन बताए मैंने, 2 ऑप्शन।
अच्छा सर, कुटज पर्पटी का किस में योगदान है सर?
कुटज पर्पटी जब IBS रहता है, लूज मोशन प्रवाहिका रहता है, अल्सरेटिव कोलाइटिस रहता है, क्रॉन्स डिजीज, जब लूज मोशन हो रहा है तो कुटज देते हैं।
हाँ तब तो मैं वो उसको कुटज पर्पटी दे देती हूँ। कभी कभी लूज मोशन हो जाता है, कभी कभी कॉन्स्टिपेशन हो जाता है,
हाँ।
और सर कभी कभी पेट में भी दर्द होने लगता है, पूरा बॉडी भी एक होने लगता है उसको ऐसे
जी।
और उसका वेट 35 kg है
जी।
चलो सर, ये पंचामृत पर्पटी का वर्धमान प्रयोग सर कब करते हैं?
वो दीप्ति जी बता रही थी ना कि निगम सर ने बताया था रसायन मात्रा में।
मैम ने एक भी बार बताया था। हेलो, दीप्ति मैम है क्या?
हाँ जी मैम, बोलिए।
मैम वो एक बार आपने पंचामृत पर्पटी का ना वर्धमान प्रयोग बताया था।
हाँ
मैम ये कब कर सकते हैं हम लोग और कैसे करते हैं?
सी आपके पेशेंट के जब ग्रहणी के सिम्टम्स थोड़े सबसाइड हो जाए ना, तो ये जो बार बार होता है ना कि थोड़ा थोड़ा कुछ खा लेते हैं फिर से हो जाता है, तो ग्रहणी के लिए जो रसायन है तो वो पर्पटी रसायन है। ग्रहणी के लिए जब हमारा डिसीज क्योर करने के बाद कभी भी रसायन देते हैं ना, तो ग्रहणी के लिए अगर कोई रसायन देना है तो वो पर्पटी कल्प है। तो फिर आप पंचामृत पर्पटी या फिर रस पर्पटी, सुवर्ण पर्पटी जो भी है कर सकते हैं। थोड़े से उसका आम पाचन होना चाहिए, अग्नि अच्छा होना चाहिए, और मोशंस थोड़े से कंट्रोल में हो जाए। दिन में अगर 4-5 बार जा रहा है, वो 2-3 बार भी जा रहा है, तो अगर स्टार्ट करेंगे तो काफी अच्छा फायदा मिलता है। रिकरेंस जल्दी नहीं होता है ये।
मैम कैसे करते हैं मैम? जैसे 125 mg से हमने स्टार्ट किया।
नहीं नहीं, वैसा नहीं है। ये पर पर्टिकल पर कैसा है, डेली आपको 100 मिलीग्राम की एक 10 ग्राम का ये आता है, 10 ग्राम का वो ये आता है, डब्बी आता है। उसके आपने इक्वल 100 पुड़िया बना ली तो एक पुड़ी में आपके 100 मिलीग्राम आएगा पर पटी, है ना। एक पुड़ी में 100 मिलीग्राम आएगा। तो फर्स्ट डे आपको 100 मिलीग्राम देना है, सेकेंड डे 200 देना है, थर्ड डे 300, ऐसे 10 दिन तक बढ़ाते जाना है। और फिर 11वें मतलब एक एक पुड़ी आप 100 मिलीग्राम की बनाएंगे तो पहले दिन एक पुड़ी, दूसरे दिन 2, तीसरे दिन 3, ऐसे 10वें दिन 10 आएगा। फिर 11वें दिन से फिर 9 आएगी, 12वें दिन फिर 8 आएगी, ऐसे डिक्रीज करके ये 20 डेज का कल्प होता है।
अच्छा मैम, और मैम पथ्य फिर इसमें कोई सब
हाँ ये पथ्य, हाँ बिल्कुल सात्विक डाइट इसमें खाना पड़ता है ना, जैसे बेकरी का बिल्कुल भी नहीं खाना चाहिए, लघु आहार ही खाना चाहिए। तक्र का सेवन, ज्यादा से ज्यादा तक्र खाइए। मैंने बोला था कि खाना कम खाइए, तक्र ज्यादा खाइए। और ये जो पुड़ी है वो जीरा के, शहद जीरा के पाउडर के साथ देनी है सुबह रसायन काल में।
मैम शहद जीरा या स्याह जीरा?
शहद जीरा, बड़ा जीरा नहीं आता है वो मसाले में का, शहद जीरा बोलते हैं उसको।
अच्छा स्याह जीरा मैम, पतले पतले से।
हाँ, उसके चूर्ण के साथ देनी है। अगर पित्त का अनुबंध नहीं है, थोड़ा हींग भी डालने को बोला था सर ने, पर मेरा पित्त ग्रह नहीं था तो मैंने हींग नहीं बोला था, ओनली स्याह जीरा बोला था। और तक्र दिन भर ज्यादा पिए और ज्यादा धूप में नहीं जाना है बस।
अच्छा ठीक ठीक, थैंक
तो
यू।
अभी सेशन बंद कर दे क्या? टाइम हो गया, कल फिर मिलेंगे।
मैं कहना चाहती हूँ ग्रहणी के बारे में। जो
हाँ।
चिकित्सा सूत्र है उसमें लिखा है कि पक्वाशय स तैले ही बिंबिषिणावतिष्ठते। तो जो बस्ती देना है वो ज्यादा मात्रा में तेल का दिया तो यानी पक्वाशय स तैले पूरी तरह से यानी ज्यादा मात्रा में तेल दिया बस्ती तो ग्रहणी का नाश होता है। और प्रवीण सर ने जी भी ये बताया था और उन्होंने एक केस भी डिस्कस किया था इस पे।
जी
तो
क्या मैडम ज्यादा मात्रा में दिया तो?
बस्ती का तेल है यानी पक्वाशय भरना है, ऐसा पक्वाशय स तैले ही बिंबिषि नावतिष्ठते, ऐसा चिकित्सा सूत्र आया है ग्रहणी का। तो उस तरह दिया तो बहुत फायदा होता है।
जी बहुत बढ़िया बताया आपने।
सर एक क्वेश्चन पूछना था, ग्रहणी में अगर एसोसिएटेड सिम्टम्स में उसकी अगर ज्यादा प्रॉब्लम है और उसकी वजह से यूरिनरी सिम्टम्स आ रहे हैं, जैसे फ्रीक्वेंसी ऑफ यूरिन बढ़ जाना और रिटेंशन ऑफ यूरिन होना, मतलब ब्लैडर पूरी तरह से एम्प्टी नहीं हो जाना, तो इस केस में कैसे मैनेज कर सकते हैं?
कोई भी कारण से हो रहा है तो वहां आम देखना है, आम का पाचन कर दिया तो अपने मूत्र प्रवृत्ति होने लगती है। आम ही बहुत ज्यादा पानी करता है, बहुमूत्रता सिम्टम आता है आम में, और फिर बाद में मूत्रल दवाइयां हैं ही अपना।
इसमें चंद्र प्रभावती काम करेगी कि
गोक्षुरादि चंद्र प्रभावती
गोक्षुरोदा गुग्लू काम करे?
हाँ
मुस्ता काफी अच्छा काम करता है, क्लेद पाचन भी करता है, ग्रहणी में भी काम करता है, और ये मूत्र व स्रोत से भी काम करता है।
हाँ
राइट।
मुस्ता
और बस्ती
इंद्र
में
जो बताया,
हाँ बस्ती देंगे तो दोनों काम हो जाएंगे, ग्रहणी कला भी अच्छी हो जाएगी और ये मूत्र पृच्छता या फिर अतिमूत्रता का भी हो, क्योंकि वात की वजह से होता है ना ये सब, अपान वायु की वजह से। तो वो अगर अनुलोमित हो जाता है तो दोनों आपके प्रॉब्लम सॉल्व हो जाते हैं। इसलिए ये तेल का भी बताया ना मैडम ने, वो बहुत सही है।
उसमें कौन सा पित्तज अगर है ग्रहणी का सिम्टम्स तो
क्षीर वाला तेल बताया ना सर ने अभी, अच्छा है, दूध
अच्छा
से बना है, हाँ अच्छा है वो।
राइट राइट ओके।
बहुत अच्छा हो गया। अभी हम लोग सेशन बंद कर दें?
ओके सर।
आप लोग बोलिए। ठीक है,
यस सर।
तो
Thank
कल
you.
मिलेंगे सुबह 6 बजे चरक के लेक्चर में।
ओके सर।
जी थैंक यू।
शुभ रात्रि सर।
शुभ रात्रि।